Good morning and welcome to the first day of public witness hearings on tribal programs under the jurisdiction of the Interior Environment Appropriations Subcommittee. And I'm pleased to welcome back my Native American sisters and brothers to discuss the needs and challenges facing Indian country for the second year in the hopes of having a more in-depth discussion of Native American issues and what you're experiencing on your tribal lands. We have organized witnesses according to the following topics: healthcare, land, trust, natural resource management, including climate change, public safety, justice, education, tribal government, and human services. Now today we'll begin from hearing from witnesses on the healthcare needs and challenges before transitioning to issues related to climate change, land trust, and natural resources today. The United States government entered into treaties guaranteeing healthcare to Native Americans. A few months ago, I traveled to South Dakota, and I saw firsthand how centuries later, the government, our government, the U.S. government, is still not meeting its responsibilities. The need for investment in healthcare and related facilities is real, and we continue to do the best we can with the allocation we are given. Last year, Congress provided $241 million increase to Indian Country Health Services. This is a 4% increase. Included additional funds to address the 105 lease costs. As part of the bill, we directed IHS and BIA and OMB to consider whether these costs should be funded as an indefinite appropriation. I was pleased to see that the President recognized the importance of this issue and included such a proposal in the President's FY21 budget request. In addition, last summer, I had the opportunity to visit tribes in Minnesota, and Mr. Joyce and I traveled to Washington State to visit tribes in Mr. Kilmer's district. We met with tribal leaders and learned more about climate change and impacts on health, safety, and cultural well-being of Native Americans, as well as some issues surrounding land and natural resource management. Future generations deserve clean air, clean water, drinkable water, but we must give these issues our fullest attention now. For fiscal year 2020, Congress included additional funds for BIA natural resource management programs, included increased funding for climate resilience, endangered species, and water resources. I was disappointed, but not surprised, that the President's budget request released yesterday once again ignores climate change. No one is immune from climate change, especially not Native Americans, who are at the forefront of experiencing the effects of increasing temperature rises and water rising. Your written testimony describes in very real detail the impacts of climate change is having on Native Americans. Melting permafrost in Alaska, the loss of traditional foods, unprecedented flooding, and it's happening right now in Washington and Oregon State. And I know that there have been tribal villages that had to be evacuated. Our hearts are with them. But yet, the President, Mr. Trump, looks the other way. Well, luckily, the President proposes and Congress disposes. So at the beginning of this Congress, I want you to also know that I introduced a bill, H.R. 1128, to authorize advance appropriations for tribal funds. As we figured out how to meet the needs of Native Americans, I will continue to work towards passage of this vital legislation. Most recently, I did write a letter to the Budget Committee requesting that hearings be held on this, and I know you're talking to members about this issue as well. Well, I'm eager, along with Mr. Quigley here, to learn more about your priorities, and I look forward to our discussion on these issues because I believe it will help us to inform as we begin to develop the 2021 appropriations bill. Now, I'm going to cover a few hearing logistics, and when Mr. Joyce comes in, if he has an opening statement, I will yield to him at that time. Anything you'd like to say at this time, Mr. Quigley?
Anxious to hear what
Okay.
you have to say.
All right. So we've got the timer out here, and we already have our first panel of witnesses at the table. Each witness will have 5 minutes to present their testimony, and we'll be using a tracker to track time. Don't worry. It's highlighted in here. I have read all your testimony. I'm going to take notes on it. We all have it. If you run out of time, please know it's fully entered into the record. But when you see the light blink yellow, you have a minute to close your remarks. And when the light blinks red, I will lightly tap with this gavel, which is made of buckthorn, an invasive species here, to let you know that you need to stop your remarks so that the next witness can begin, so that we are respectful of everyone's time here. And as I said, everybody's statement will be entered into the record. Don't feel any pressure. After we hear testimony, each witness on the panel and members will have an opportunity to ask questions. And I'd like to remind those of you joining us in the committee hearing room here today of the committee rules. They prohibit the use of cameras and audio equipment during the hearing by individuals without House-issued press credentials. So, when this hearing concludes, we will reconvene at 1 o'clock for the afternoon hearing. And so with that, we found out a way to kind of save a little time. Rather than do double introductions, we are just having the panel introduce themselves. And that left more time for questions, which I really love to have. So I will let you start out, Ms. Greene.
So introducing ourselves is what we're doing.
And just make sure that little button is red.
Okay. Good morning, or Tatsmeawi. My name is Chantel Greene, and I'm representing the Nez Perce Tribe. And I serve as the Secretary Officer currently.
Go right into testimony.
No, go right into your testimony.
Okay, okay.
I'm sorry.
Okay. Again, good morning, Honorable Chairwoman and members of the subcommittee. Again, my name is Chantel Greene, and I serve as the Secretary of the Nez Perce Tribe Executive Committee. Thank you for the opportunity to provide this testimony on behalf of the Nez Perce Tribe as the committee evaluates and prioritizes fiscal year 2021 appropriations. I would also like to thank Chairwoman McCollum and Congresswoman Pingree for their letter regarding a mining project in the Nez Perce country. Today, I would like to emphasize the need for sufficient resources in areas such as the Community Health Aid Program, IHS, Purchase Referred Care, contract support costs, special diabetes, mental health, and substance abuse programs. The CHAP was established over 40 years ago to help expand access to care in Indian country in areas such as behavioral health, dental health, and community health. The tribe believes the CHAP model is an important tool for tribal health programs that should be provided the resources to grow as it increases tribally based practice and knowledge that are culturally and evidence-based holistic methodologies and are operative abilities similar to wraparound. The tribe appreciates the committee's support of broadening the program by providing $5 million in fiscal year 2020 for expansion. The tribe feels the successful program is needed and ready to be duplicated in the Northwest. As a result, the tribe supports the Northwest Preliminary Health Board's effort to be designated a demonstration site by IHS so that certification of these healthcare assets can move forward. In that regard, the tribe recommends the committee provide $20 million in fiscal year 2021 for continued expansion of CHAP. The Nez Perce Tribe, with an enrollment of 3,500, operates the Nemupo Health Clinic on the Nez Perce Reservation and provides services to almost 5,000 patients each year. Our expenditure total of fiscal year funds and federal funds in fiscal year 2019 was $18 million, an increase of $1.6 million from that in fiscal year 2018. Purchase referred care costs for outpatient services in fiscal year 2019 totaled $5 million, which is an increase of almost $700,000 from fiscal year 2018. The tribe recommends, at a minimum, maintaining the $6.05 million in funding for IHS in fiscal year 2020. Please note that this amount does not keep up with medical inflation and population growth or limitations on prescription drugs. The tribe supports an increase of at least $20 million in funding for PRC to meet the PRC spending needs of tribal health facilities, since a budget increase was not provided in fiscal year 2020. The tribe supports full funding for contract support costs in fiscal year 2021 and the inclusion of bill language to classify this appropriation as indefinite. The tribe appreciates that Congress chose to fully fund contract support costs in fiscal year 2020 at $820 million, as it should per any agreement. In addition, the tribe recommends permanent mandatory funding of the SDPI at no less than $150 million per fiscal year. In that regard, similar levels of funding are strongly recommended for mental health and substance abuse treatment, and that SDPI be a model program for these type of services. Although the 10 million annual allocation for mental health and substance abuse is very important, it falls well below the financial needs to provide adequate care and treatment on reservations. In conclusion, the tribe would like to express our support for the budget recommendations of the Northwest Portland Area Health Board, including but not limited to the recommendations of 105 LISA costs, population growth and medical inflation costs, loan repayment for Indian health professionals, small ambulatory programs, and funds for updating technology and patient files. Thank you for the opportunity to testify today. I'm happy to answer any questions you may have.
Thank you. Just maybe as a guide, the SDB program is Special Diabetics program. And maybe the first time before we use the initials, some of us are familiar with it. We have other people who might be listening in on C-SPAN, and it's our opportunity to share and to share the educational meaning of why you're here to inform Congress. Thank you.
Great job. Good morning, Ani Bonjour. My name is Peyman. I'm the chairperson of the Southcentral Tribe of Chippewa Indians. My tribe is located in the Upper Peninsula of Michigan and is the largest tribe east of the Mississippi with nearly 44,000 tribal citizens. Our territory is 2,800 acres of trust land, and our ceded territory is 1/3 of Michigan, where we exercise our treaty rights, reserve rights to fish, hunt, and gather. We administer 23 governmental divisions and departments and manage 75 federal, state, local, and tribally funded programs across the 7-county service area. We provide a full range of services to our citizens like healthcare, education, elder services, law enforcement, housing, family and social services, and cultural programs. We also operate 8 health clinics across our purchase and referred service area. We offer a wide range of services including mental, dental, behavioral health, special diabetes, nutrition, pharmacy, wellness programs, and traditional medicine. We're proud of our healthcare delivery system, but we believe there is a void and it's time to fill that void. The focus of my testimony is to request that the Appropriations Committee examine how IHS addresses healthcare facility needs throughout Indian country. Of concern is the adherence to a priority list that was developed in the 1980s. Healthcare delivery has changed, and the illnesses and diseases that we seek to treat have changed, in some cases dramatically. Healthcare cannot be provided in isolation, but must be provided in a holistic and comprehensive way, grounded in traditional beliefs and practices. A team-based model of care is more adept in being able to combat our emerging top healthcare priority, which is alcohol and drug addiction, including the opiate crisis. Last February, we announced a collaboration with the Hazelton Betty Ford Foundation to expand our substance abuse use treatment and recovery services and enhance our integrated healthcare and wellness center to build a true team-based facility to support those in our surrounding Native community. A Sioux Tribe Recovery Hospital and Campus concept is provided in the tribe's Tribal Action Plan, one of the first approved in the nation. While creating our TAP, our people voiced the need for a recovery campus close to home, with traditional medicine at its core to combat the historical trauma outcomes that have plagued tribal communities as a result of federal Indian policy. Our holistic plan is to heal those afflicted as well as their families and communities. Only with family support and healthy living will we be able to defeat this crisis. Our new facility, when built, will be a one-stop shop with those struggling with addiction. We intend to start with detox, then inpatient treatment with halfway, three-quarter way, and longer-term residential recovery environments. Intensive outpatient programming with supports like recovery coaches will follow. We intend to create a never-before comprehensive family reunification process built on our Anishinaabe of healing and healthy living. One of the biggest factors of staying sober is the person having a place to live or begin to return to life as a sober person. All too often, a person goes into treatment only to come home to the same social dynamic they left to get well. This leads to relapse. We want our recovery campus to be a pathway, the good red road to success that can be recreated across Indian country to combat the opiate and heroin crisis. At our recovery campus, those afflicted will have the access to drug treatment and behavioral health care that is informed by our traditional cultural healing. Immediate access to healthcare services will enable us to properly manage any medical health conditions that a patient might face. To effectively treat addiction, we have to treat the whole person and address each condition, be it physical, emotional, mental, or spiritual, that led to the individual to self-medicate. We have been confronted by many who tell us this kind of facility has not and will never be built. But my ancestors overcame too much for me to simply give up because something has never been done before. I believe we can do it, and I'm here to ask you to help us to make this a reality. We will support Congress providing joint venture funding. We have identified a deficiency in the program, however. We think there should be a geographical diversity with regard to joint venture selection process. It's time for Congress to provide $50 million to fund the Indian Healthcare Delivery Demonstration Project, which was intended to build facilities with that are different than the clinics that we currently fund. The demonstration project was intended for facilities like the Sioux Tribe Recovery Hospital on campus, which we deliver in a different model and a holistic model. I believe that my tribe's recovery model is exactly what Congress was considering when it created the Indian Healthcare Delivery Demonstration Project. It's beyond time for Congress to provide funding for this initiative, and we're willing to be that demonstration project. Thank you.
Thank you, Chairman Cullen, Ranking Member Joyce, and members of the subcommittee for the opportunity to testify on Indian healthcare needs for the fiscal year 2021 budget. My name is William Harris. I am the chief of the Catawba Nation, the only federally recognized tribe in the state of South Carolina. Let me begin by acknowledging the hard work of this subcommittee in protecting and advancing Indian country interests in the federal budget. The appropriations process is vital to fulfilling federal treaty needs and trust obligations, and we encourage you to continue the fight to good fight. For my testimony today, I would like to focus on the theme of prevention for Indian health. Preventive health saves lives and costs in the long term, a situation that benefits all Americans. As a direct service tribe, the Catawba Nation depends on the IHS for the delivery of healthcare services. Our local IHS service unit, however, has restricted operating hours and services that impair access to care within the community. An investment in preventive health service is not a substitute for quality comprehensive health care. It is a critical component of overall health that is often overlooked. Advanced appropriations, a central way for this subcommittee to support Indian health is through advanced appropriations for the IHS. Advanced appropriations would provide the IHS parity with other direct service federal health agencies, provide funding stability across fiscal years, and show that the federal government is committed to its trust obligations. Invest in holistic health care. In response to shortcomings in IHS services, the Catawba Indian Nation has taken a proactive approach to community health. Our Wellness Warriors program uses health education, physical activity, nutrition, and tobacco cessation programs to help our members lay a foundation for lifelong health. Through prevention and education, we aim to reduce incident rates of disease, promote wellness, alleviate burdens on the Indian Health Service. We urge this subcommittee to increase funding for the Preventive Health Services account in fiscal year 2021 and build the infrastructure for access for health care. On an elementary level, no amount of investment in or quantity of preventive health services will benefit a community if the people cannot reach them. Roads in the Indian country are notoriously bad. Unsafe roads obstruct access to appointments and emergency services. They also damage vehicles, causing further strain on IHS and tribal resources. An influx of money into the BIA roads maintenance account is urgently needed to build the infrastructure Indian country needs for public health and safety. Quality health requires a quality environment. The EPA is a central agency fulfilling the federal government's trust and treaty obligations to protect Indian health. If our waters, air, and soil are polluted, our bodies will be as well. Quality human health requires the sustained presence of a quality natural environment. Our tribe and many others have utilized EPA resources to protect and promote tribal health. For example, we partner with the state to generate air quality forecasts for a 3-county area, and for water quality, we establish a water monitoring program using Clean Water Act funding. We urge you to maintain adequate funding for EPA environmental quality programs as a fundamental component of the preventive health. And I thank you for the consideration of my tribe's testimony. I'll be glad to ask any questions you answer.
Good morning, Chairwoman McCollum, Ranking Member Joyce, and Committee Member Quigley. My name is Donovan White. I'm chairman of the Siston Wahpeton Sioux Tribe, one of the 7 great Sioux nations of the Midwest. For years, we've been working on building our Community Justice and Rehabilitation Center. We've been working on this for more than a decade. We need this Justice Center to combat the serious violent crime, drug crime that's plaguing our reservation. This center will also provide much-needed alcohol, drug treatment, as well as mental health detox, transitional care, and inpatient, outpatient, adult, and youth services. We plan to build this center as a unified facility, but with the end of earmarks and the IHS General Counsel rulings limit our ability to build this unified center. SWO Adult Detention Center. The urgency of building our Community Justice Center intensified in 2016 when the BIA closed our outdated and deficient condemned jail without a replacement plan. This created many public safety problems on top of an already perilous situation on our reservation. As a result, we worked very hard with our congressional representatives and with this committee to restore this detention construction funding in the BIA budget. Thankfully, under the fiscal year 2018 Interior Appropriations Act, the BIA awarded us $5.175 million to design and construct a 25-bed medium security adult detention facility. This is a major first step in developing our Justice Center. Wopata Tonka, big thanks to this committee and to Congress. After a year of discussion with the BIA, our project is now underway. We signed our 638 contract and issued a RFP for an A&E firm. The BIA is also developing a model to construct an adult detention facility. This will guide our project, subject to modifications to meet our site location and to reflect our Dakota culture. Adult high security detention cell wing. Next, we need a high security detention block as part of our new detention facility. We will need increased detention staffing. We urgently need to detain the most serious offenders in our high security setting, including those sentenced under TLOA Enhanced Security Sentencing Authority. In fiscal year 20, Senate directed the BIA to work with us to consider a high security block and develop a cost estimate and report back in 60 days. We estimate that the $4 million will be needed to build a 20-cell high security wing. BIA detention has not consulted with us yet, and we need extra 30 days on the deadline for the report for them to consult with us. Inpatient Drug and Alcohol Treatment Center. We are also in dire need of an inpatient alcohol and drug treatment center. In the past year, we've had 6 fatal drug overdoses. That's 5 times higher than the national average. In the past 2 months, 6 babies have been born under the influence of drugs. We have to stop this tragic trend. In the mid-2000s, a comprehensive health planning effort identified behavioral health and drug dependency as a leading health problem on our reservation. We have a treatment center, and it was built in the early 70s, and it's fallen apart. It only holds, we can only treat about 10 people at a time. And as you know, the opiate and the meth and now the fentanyl deaths have taken over. And I'm off script here, but I don't need to read all of this, but meth, opiates, fentanyl is killing our people. Not only that, it's destroying our homes. You know, the meth gets made in the homes. So we've been very successful in the last 30 years with our gaming. But leadership, we've let our people down, and we shouldn't have to come here, you know, to ask for money all the time. But we've been very successful. But now, new leadership, we need to move forward. Drugs are killing our people, and our babies are being born addicted to meth and stuff. And you know, being a sociology major, you know, we pay now or we pay later, right? You know, so, and we have problems with law enforcement, and it affects everybody. It affects the counties. It affects all of the cities, because our people are being locked up, and all of the jails, prisons are full of our people. So we need long-term treatment, and we need help with funding with long-term treatment center. And not only that, is a lot of our people go to prison, right? Or they get court-ordered to treatment is when they usually go, when they're court-ordered. But we need long-term aftercare. You've got to support our people when they get out of prison or they get out of treatment. So we need that. So the drug epidemic is killing our people, literally, and we've had 6 overdoses in the last year. So, but it's everybody's problem, not just our problem. It's the counties and the cities. Their jails are full too. So we've got to look at fixing the problem. And over my time, so I appreciate you guys seeing me and listening to my testimony and you know, begging for assistance. So thank you.
Good morning, Chairwoman McCullum, Ranking Member Joyce, and members of the subcommittee. My name is Robert McGill, and I'm honored to serve as chairman of the Auction Indian community and to give testimony to you today on our community's priorities. First, I would like to thank all of the members of this subcommittee for inviting me to testify today. Despite the Trump administration's consistently proposing cuts every year to the many programs that tribes utilize, this subcommittee increased funding for the Bureau of Indian Affairs and the Bureau of Indian Education in FY 2020 by $142 million over FY 2019. This subcommittee also increased funding to the Indian Health Services by $243 million over the FY 2019 enacted level. This increased funding will help tribal governments, including ours, provide quality health services to their citizens. Thank you for your continued dedication to the trust responsibilities of the federal government to tribes and for these increases in funding for FY 2020. Thank you. Before I begin our funding priorities, I'd like to tell you a little bit about the Auction Indian community. We are and always have been a farming tribe, and our name is directly derived from an Otham word that refers to the type of farming traditionally practiced by the Auction people. Throughout our history, we have relied on subsistence and eventually commercial farming for sustenance. Today, we own and operate the Auction farms. We cultivate more than 15,000 acres of farmland, and the farms has been a central economic enterprise for the community since the 1960s. We are a small but growing tribe with 1,130 enrolled community members today, and as the area surrounding us continues to grow at one of the fastest rates in the nation, we are committed to being good neighbors while also working hard to build a stronger future for the next generation of Auction community members. This is my 5th appearance before the subcommittee, and today I'm here to testify on a number of important issues to the community, including funding for health care programs and tribal self-governance. My testimony today will focus on a handful of programs that our tribe utilizes for the benefit of our people. Although it is important for me to be here to speak on these issues today, we are advocating for funding for these and others to speak on these issues today, programs every day that we deal with. As you know, the Indian Health Service and the Bureau of Indian Affairs are both on the Government Accountability's Office high-risk list. We hope the subcommittee can address these and join us in supporting a budget that assists tribal communities in advancing sustainable tribal programs. Self-governance. The Auction Indian community is a compacted self-governance tribe with the BIA. The compact enables the United States to maintain and improve its unique and continuing trust relationships and responsibilities to the community through tribal self-governance for various programs, services, functions, and activities such as our public safety, social services, courts, road maintenance, and various other vital programs. Currently, the community has a self-governance compact with the Indian Health Service for our emergency medical service ambulance program and our health education program. We are proud to provide these important services, but they are just a first step towards improving the healthcare options of our entire community. Ultimately, it is our goal to make informed decisions about which PSFAs to assume, and this is our goal and necessary steps to successfully support these programs. The community applied and received 2 tribal self-governance IHS cooperative agreement grants under planning and negotiation. We are truly appreciative as this funding has been an asset while our community upgrades and modernizes our healthcare system. Because of the success of tribal governance, we asked the subcommittee to expand self-governance status to include any programs that tribes are eligible for both in IHS and DOI, Department of Interior, as well as being open to compacting under other federal agencies. Our self-governance programs have been a model of success. We have the opportunity to self-govern more of our programs. It will undoubtedly lead to higher quality services for our community. Advanced appropriations. As you know, advance appropriations would ensure that funds are available in advance to alleviate the unfortunate circumstances so many tribes faced during the partial government shutdown last year. Currently, critical federal programs of the Department of Education, Department of Housing and Urban Development, Department of Labor, and Veterans Affairs are all authorized for advance appropriations. Funding uncertainty causes tribes to redistribute funds from other tribal programs just to continue to operate programs. Advance appropriations would prevent future lapses in funding associated with potential funding delays and will help keep in critical services uninterrupted. We ask for your support for advance appropriations, BIA, BIE, and Indian Health funding. In conclusion, again, there's a lot of other topics that we want to discuss, and you do have our testimony, definitely, and we appreciate that. Again, I would like to thank the chairwoman and ranking members for holding this hearing and engaging in government-to-government consultation to hear our community's priorities. We hope this subcommittee will continue its good work and address the challenges we continue to face. I hope my testimony today has given you the meaningful insight into these federal programs and how they are positively impacting our community members. So again, thank you.
Well, thank you, sir, and thank you for, I do have your full testimony for mentioning Johnson O'Malley and,
Yeah.
and the well-being that plays for children, for healthcare, and for our communities. Mr. Joyce, would you like to make any opening remarks at this time?
Well, I would pass on it in that I was late. I just want to apologize for that. Our mutual friend, Mr. Bradley, who said to say hello to you, was making his case. And I told him that I was going to be held in contempt by you if he didn't stop and let me get on to this. I would have one quick question for Ms. Greene. In your testimony, you mentioned that the local hospital has stopped taking the tribal insurance. What does that do to your budget?
So yes, to explain a little bit, our current situation, which has just been recently resolved through our insurance, is the main insurance that we go through, which is Regents. Our local hospital, which is identified as a St. Joe's Hospital, took new leadership, and with their new leadership, they decided to not go into agreements with Regents Insurance, which includes our third-party billing. So that hits our purchase referred care very hard. So as of January 16th, they were no longer going to be accepting except for under continuity of care for higher level of care, such as cancer and those type of higher levels. As for the numbers, I would still need to get back to the numbers because they did just recently come under agreement. They backdated that to January 15th. So hoping that we won't see, I'm sure in our billing and our purchase referred care referral service, we're going to see some interruption, but they did backdate that to January 15th. So as of right now, hopefully we won't be seeing too many issues there. So that was resolved. Having to look down the future, in our billing process, so that we don't end up in this situation again. We're having to readjust our own systems and kind of start looking at self-funding, because at the end of the day, we have to look out for the overall health and well-being, and if we can't be at the mercy of two other organizations and then be taking hits to our purchase referred care budget. So, thank you.
Before I
Well,
go to
thank-
Mr. Quigley, I have a follow-up on that.
Okay.
Do you know if that insurance company takes Medicare, Medicaid, and VA, and now that we have some of the VA that people can do outside, do you know if they take that, or could you find out?
Yes, we can, and we can follow up on that with you.
It would be interesting that they would take every federal program, but one that's done through the Bureau of Indian Affairs.
And I apologize because I'm going to the National Congress, but I'll be
Yeah.
back.
Mr. Quigley?
Thank you, Madam Chairman. Thank you for all your service to your communities and for being here. Let me ask a related question because it impacts everything else. We hear of the national economic outlook, unemployment rates, how the economy is going. We don't have a lot of time in each of our segments, but could a couple of you give me a snapshot as to how the picture looks in your own communities?
I don't see a whole lot of, I haven't seen a whole lot of change at all in our economics on the reservation within our boundaries. If you go to some of the bigger cities, there are some, like Watertown, there are some companies that have came in, but to the smaller communities, I would, if you were to ask the people, I would say it's probably going backwards. I would think some of the help is the bigger factories into bigger towns, but on the reservations, I don't see the improvement at all.
Just identify yourself for the record. It's just.
Okay, I would like to speak. I'm Chantel Greene with the Nez Perce Tribe again. With our economics, we're actually having to look at our own natural resources. I know I'm on the healthcare panel, speaking specifically to that because the rural aspects for the shortage of providers, that's been a major impact to our healthcare as well. In Idaho, we just passed the dental health aid therapy through the for Medicaid, Medicare to get that program standing up. However, we're still seeing issues with that in the rulemaking. So making sure that we can provide adequate care when we don't have providers who want to actually be rural. So that's been our issue. So it's one thing to actually get the providers there, but because of the cost of living and the market values, it's looked as an area that they don't want to be in, versus in Idaho it'd be Boise location area. And so us looking at our holistic models, we're actually looking at our natural resources and the climate change and energy development. So we're trying to readjust to the circular economy and utilizing our natural resources and developments in solar and small modular reactors. Those are new developments because we are pretty much maxing out our gaming our gaming, which is also in the state of Idaho is a major impact. We are the third largest employer in the state, so our economic impacts to these states specifically is incredible. If shut down all five tribes of our all five tribes in Idaho, there would be a recession in Idaho.
I am quite envious of the two statements prior to mine. My name is William Harris. I am the chief of the Catawba Nation. We do not have economic development on our small reservation. South Carolina has not yielded from the growth that has happened throughout the nation. And we are one of the restricted settlement tribes as well. So
Could you assess the unemployment rate within your tribe?
it's double what is in South Carolina. So we're in double digits on the reservation, even though South Carolina itself is not. So grants are what sustain our community.
Thank you.
Robert McGill, chairman of the Auction Community. Fortunately for us, we're a small tribe, again, and we're about 40 miles south of Phoenix, Arizona. And so in our area, in Pinal County, in Arizona, we're one of the fastest growing counties in the United States. So we've been able to be fortunate enough to capitalize that in a sense. Currently, our economic development in the enterprises we do have in the community, we've been fortunate enough to employ a little over 1,500 people at our casino, which is, I think, still number one as far as employment for Pinal County. And we have a little over 500 in our government operations for our community and 400 overall for other areas in that. So again, the employment we've been able to offer for the area has been tremendous, has been great, and we continue to grow. So we're looking forward to that. But again, we've helped Arizona, I believe, financially in being able to accommodate them in different areas and needs through our 12% through our compact negotiations that we give back to the state. And then we do other things that are unknown. So we've been able to provide a number of services and just the opportunities for Arizona overall. So.
So we're the largest non-government.
You want to be?
Oh, I'm sorry.
You want to be Doctor, Vice Chair, or the Honorable
Dr.
Mr.
Chair.
Payment? Dr. Chair. Dr. Chair Payment.
And the honorable of the Sault Ste. Marie Tribe of Chippewa Indian. So we are the largest non-government employer in the Upper Peninsula of Michigan, the only next to prisons, sadly. But the biggest threat, we haven't really seen any change. In fact, we're the resiliency factor in rural communities that provide jobs when the economy is bad, because people come to casinos whether the economy is good or bad, and we haven't seen any increase in people coming to casinos because of the expected trickle-down economic impact that's happening right now. But the bigger threat is the work requirement to the Affordable Care Act expansion, because we increased our revenue by 10 million. Our AFA, our IHS funding is 30 million. We increased by $10 million. So we increased it by 1/4 of our health delivery system because of the Affordable Care Act. That's at threat right now. CMS, we fought CMS and HHS because they were saying it was discriminatory, it's a violation of civil rights laws. All that was made up. There was no substance to that. They capitulated. Arizona pushed it, and they played a game of chicken, and Arizona won. And so now we can add it. But the problem, the damage is done because legislatures put the work requirement. Indians should be exempted from the work requirement. We're already the engine. And so at risk is $10 million to our economy that will be drastic. So.
Thank you. Mr. Simpson?
No questions. I just apologize for being late, but I'm glad you're here. Like hearing your testimony.
Well, we'll have the, thank you all, and I know it's a very busy 2 days for you, so thank you for making time and coming and sharing. We'll have the next panel come up, please.
Thank you.
We'll be hearing from the National Indian Health Board, Southcentral Foundation, Riverside San Bernardino County Indian Health, Inc. Have we heard that people are running late or anything?
Yeah, I have no idea. Maybe Tyler wants to check outside. We have Tyler check outside. Yeah, check out.
The other panel finished right on time, and so we're gonna check outside to see if your other colleagues who are gonna join the panel are here, and if not, we'll start right away with you, Ms. Sanchez.
End of the day, we gotta figure it out. Leave in Washington, I'm gonna find out.
Good morning. I'm going to have you introduce yourselves. We'll go down. We'll start with the other end of the table, and you can go right into your testimony from that. The timer is set for 5 minutes. At 1 minute, you'll see a yellow light, and then if you get into that yellow light a little bit, I'll lightly tap the gavel, and when it's red, we ask you to please conclude your remarks. We have all your testimony in the record. Thank you. And do you need another second, or are you ready to go? Thank you. And you need to push the red button down there, and they like it if the microphone's close so it can be recorded. Thank you. Good morning.
Good morning.
Yeah.
Good morning. My name is, good morning, Chairwoman McCollum, Ranking Member Joyce, and members of the subcommittee. On behalf of the National Indian Health Board, I'm thankful to testify on the FY 2021 Indian Health Service budget. My name is Victoria Kitcheon. I'm the Chair and Great Plains Area Representative to the National Indian Health Board. I'm a member of the Winnebago Tribal Council. And as we work together on the first IHS budget of the decade, let's reflect on some of the great successes of the past 10 years. We began the previous decade with a tremendous victory with permanent reauthorization of the Indian Healthcare Improvement Act. This was an incredible victory that ensured the foundation of the Indian health system will persevere. Because of this congressional action, we were also able to secure rightful and full funding of the contract support cost. Thanks to you, the 2010 enacted IHS budget was $4.02 billion, and we ended in 2020 with $6.04 billion. During this same time span, we saw third-party reimbursements from public and private payers reach over $1 billion for federally operated health care facilities alone. Our people made dramatic gains in health care coverage, improving access to care and revenue streams for our services and facilities. Overall, we continue to applaud the leadership and the partnership of this committee to help secure those successful legislations, but they have been achieved alongside great challenges, and the road in front of us remains long. Our people continue to live 5.5 years longer, less than general population, and in the Great Plains, where I'm from, 20 years earlier. Our people continue to have the lowest health outcomes and the highest health disparities. For example, infant mortality continues to rise in our communities while it's decreasing through the rest of the country. The fate of the Indian Health Care Improvement Act remains in balance due to legal challenges to the Affordable Care Act. Our public health infrastructure remains decades behind state and local entities. Our communities continue to be overlooked when new block grants or opportunities are introduced. Our hospitals remain 4 times older than the rest of America's hospitals. If one was built today, it would not be rebuilt for 400 years. Our provider shortages remain severe with chronic vacancies from physicians to behavioral health professionals, pharmacists. So in every year of the previous decade, there were delays in passage of the IHS budget, leading to one continuing resolution after another. On 4 occasions, IHS was shut down because lawmakers couldn't agree on a final budget. The budget disagreements had nothing to do with Indian country or the IHS, and our people suffered nonetheless. Those shutdowns lasted from 1 day to the longest in history at 35 days. In each of those instances, our healthcare was shut down. Our people were endangered. Each of those shutdowns violated the solemn responsibility of the United States to our tribes and people. Every year, tribal leaders from across the country convene in Washington, D.C. to formulate the National Tribal Budget Formulation Recommendations for a needs-based and fully funded IHS budget. Their recommendations reflect the national voice of tribal people. Every year, we face limitations on this discretionary budget that only allows for marginal increases to the IHS budget. For example, we were thankful last year that the committee fought really hard for a 9% increase and totaling over $530 million. And when that final agreement was reached, it was cut by half. So when you compound chronic underfunding, continuing resolutions, the inevitable result are pervasive disparities for our people. So where does that leave us? We ask you, as we start this decade, to just reimagine how we fund the Indian Health Service. We begin this decade with a monumental victory, and we can do that by passing advanced appropriations. We're very thankful to Chairwoman McCollum and Representative Young for introducing the legislation that would authorize advanced appropriations for our programs, and Ranking Member Joyce and others who strongly support that. We remain fully committed to working in a bipartisan way to pass advanced appropriations. We have the momentum. We can get it done this year. We can begin this decade by passing an IHS budget that reflects the recommendations of the Tribal Budget Formulation Work Group, calling for $9.1 billion for IHS in 2021. This decade must be where Congress fully lives up to its obligations to tribal nations, and this decade is where we receive full and permanent needs-based budget for IHS and all of our health programs. This must be the decade where we look back and say, this was the time when our treaties and obligations by the federal government were finally honored. So our dedication to this remains everlasting. We thank you for your commitment as well, and look forward to working alongside you on this. And I thank you for the invitation to testify, and happy to answer questions.
Thank you.
Thank you.
Go ahead.
Good morning. My name is April Kyle, and I'm from Southcentral Foundation. My tribe is Ninelchik. We are a tribal healthcare organization in the South Central region of Alaska, serving 65,000 Alaska Native and American Indian people in an area the size of Wyoming, so a really big service area. I want to share with you 6 things in 5 minutes. I'll do them quickly. First, I want to talk about funding in general, and I want to say that we appreciate the increases to funding, but until we see that health disparities between Alaska Native and American Indian people and other Americans are extinguished, the funding solution hasn't come yet. So we ask you to think about that as you're looking at the IHS budget. The second topic is 105L lease funding. We want to thank you for increasing funding levels to $125 million. We know that the IHS estimates the need as $150 million. We think that the need for that funding is great and hard to predict. And our ask is for the IHS to consult with tribes, Congress, and the OMB to figure out the right appropriation level. We also think these funds should be reclassified as appropriated entitlement. Third, I want to talk about advanced appropriations. It's a topic you've heard about before, but certainly with government shutdowns, it became very clear what the impact is for communities, and it puts people and families at risk. And I just want to remind you that the IHS is the only federal healthcare system that does not have advanced appropriation. And at Southcentral Foundation, we appreciate that there is good movement on legislation to resolve this issue. We thank the co-sponsors and we ask for your support. The fourth is behavioral health. So I serve as the Vice President of Behavioral Services. I've been with SCF for 17 years, so this is my actual topic of expertise. And at Southcentral Foundation, we're doing really good work in addiction treatment, working with kids, working with adults, working with folks in behavioral health crisis. I attend graduations and I see people's lives change because treatment works and recovery is possible. But there's a big problem. The problem is the volume of services that we can deliver, the supply, is so much smaller than the demand in our communities. And so we ask you to think about behavioral health, and we are looking for at least a 15% increase in behavioral health funding for the next budget cycle. Fifth topic is joint venture construction, highly successful program. It benefits tribes, it benefits the IHS, and we'd like to see an increase in joint venture projects to expand and grow more services across the nation. My last topic, number 6, is the VA Mission Act, and I know that's a little bit outside the scope of this hearing. We appreciate that $11 billion was appropriated to the VA to implement the Mission Act, and there's a piece of that which creates an opportunity for a medical residency pilot program in the VA where medical residents could be placed with tribal or IHS facilities for their medical residency. This is a win-win-win opportunity for tribes, for the VA, and for IHS. Our ability to deliver health care is often limited by our workforce, and so any opportunity we have to bring more doctors into our systems, that includes IHS, the VA, and tribal health care, the better that we'll be able to deliver the services that are needed by our community. We know that's not exactly in the scope of this hearing, but any influence and support you have for funding for that residency program would be greatly appreciated. So in conclusion, in the time that I've had, I've spoken about the importance of funding, 105L leases, advanced appropriations, behavioral health, which is probably my favorite topic, and the importance of truly meeting the needs of our community with behavioral health funding, joint venture, and the VA Mission Act residency program. I thank you very much for your time.
Thank you.
Good morning. I'm Teresa Sanchez. I'm a member of the Morongo Band of Mission Indians. I'm also on Tribal Council. I'm the Vice President of the Board of Directors for Riverside San Bernardino County Indian Health. I'm here, thank you for the opportunity to testify today. I want to start by saying that the Indian Health Services 105 lease program has been very beneficial in our FY 2019-2020 budget years. Our consortium puts the funding provided through this program to good use every day. Therefore, we strongly urge this committee to continue to support the tribes across the country on this critical funding issue by providing sufficient appropriations to fully fund IHS's 105 lease obligations and by reclassifying 105 appropriations as an appropriated entitlement. This is especially important for tribes in California because there is a general lack of funding for our California health facilities, and these 105 lease monies help offset the present inequities stemming from the lack of funding. Simply put, California tribes have not historically been funded to build clinics and hospitals in the ways that tribes outside of our state have. Needless to say, this lack of facility and staffing funds has been a thorn in our sides for many years. The joint venture program, which provides monies to help tribes build new clinics, still continues to disappoint California tribes. California has only had one joint venture program funded in the state since the inception of the program. In the recent 2019 application process, 7 tribal systems from California applied for this funding. However, we have been notified that none of these tribal programs were asked to continue with the application process for consideration of the joint venture opportunity. This highlights another inequity issue for California. Although the current capital projects of all the Indian Health Services are projected to be funded over the next 25 years, California does not have any projects on the current capital project plan. This will challenge us to use other sources of funding to improve our health clinics. The joint venture program should be a strong tool for California tribes to address current and future needs, but IHS does not appear to be seriously considering any California joint venture proposals. We urge the committee to direct IHS toward addressing this problem. 4 of the 12 IHS areas are designated PRC dependent, meaning they have little or no access to any IHS or tribally operated hospitals, and therefore must purchase all or a large portion of inpatient and specialty care from non-tribal providers at a significantly higher cost. Our region, the California area, has no tribal hospitals. However, the current PRC formula disproportionately affects California because it allocates PRC and hospital funding to those other 8 IHS areas. This funding inequity tends to then treat our clinics the same as those in the remaining 8 IHS areas who receive both PRC dollars as well as hospital funding. This impacts our specialty care access. IHS does not have an access to care fairness factor meant to remedy the funding inequities to the 4 PRC dependent areas. According to their own methodology, there are 3 levels of priority. Our access to care factor is at the lowest priority level of 3. Unfortunately, the PRC monies run out before the access to care fairness factor can be calculated and distributed to benefit our area. The result is our area rarely receive any access to care fairness PRC monies and therefore falls further and further behind. We ask the committee to instruct IHS to move this access to care factor from the lowest priority level 3 to level 2 priority. We thank you for your time and consideration.
Thank you. I'm going to step up to the Agriculture Committee for a minute, which also deals, as you pointed out, the other committees have jurisdiction over some of the programs that are important. And I leave you in the capable hands of the gentleman from the western part of the United States on the coast, Mr. Kilmer.
I'll do my best not to mess it up, you guys, but no promises. Mr. Simpson, do you have any questions? That's cool. All right. Thank you for your testimony. All right. Let me invite up Maureen Rosette, President of the National Council of Urban Indian Health, Greg Abrahamson, from the Northwest Portland Area Indian Health Board, Esther Lucero, from the Seattle Indian Health Board, and Shakita Bell from the American Academy of Pediatrics. I come? Happy to be here. Oh, she'll be back. Hey, welcome. I'm glad you're here. Welcome. You want to kick us off?
Yes. Good morning. Am I supposed to turn this on?
Yeah.
Hello, my name is Maureen Rosette, and I'm a citizen of the Chippewa Cree Nation, and I serve as the president of the National Council of Urban Indian Health, NCUI. We represent 41 Indian healthcare organizations across the nation who provide high-quality, culturally competent care to urban Indians, constituting over 70% of all American Indians, Alaska Natives. Thank you, Chairwoman McCullum, who just left, Ranking Member Joyce, and the rest of the committee for holding this meeting. NCUI is appreciative for the subcommittee's strong leadership and continued bipartisan support for urban Indian health. We were encouraged to see Congress come together to pass a roughly $1.3 trillion FY20 spending deal, giving the IHS approximately $6 billion, an increase of 4% above the FY19 enacted level, and $138 million above the President's budget request. Most noteworthy for us was the House bill that included $81 million to the Urban Indian Health line item. We are confident that this was instrumental in getting an increase in the final budget to $57 million, which allowed for a long overdue increase to Urban Indian Health line of approximately $6 million. This provided over $115,000 to 39 Urban Indian Health organizations. We know that the lawmakers on this subcommittee have fought for more IHS funding, and NACUI expresses our sincere appreciation. This subcommittee's recommendation last year sets that high standard for the future of this line item, and we hope you'll continue to push for the still needed increases in FY21. For FY21, NACUI requests that the subcommittee meet the tribal budget formulation work group recommendation of $106 million for the Urban Indian Health line item. Additionally, we are asking for the IHS system to receive advance appropriations. I've heard a lot of that today. And we encourage the subcommittee to sign on to Chair McCollum's bipartisan bill, H.R. 1128, Indian Programs Advance Appropriation Act, which has 48 co-sponsors presently. We cannot express how dire the effects of the government shutdown are for our programs. When funding is delayed or cut off during events such as government shutdown, there are devastating effects upon UIO's ability to provide health care. We also urge that the 100% federal medical assistance percentage FMAP include UIOs through the Urban Indian Health Parity Act. Recently, CMS announced a plan to let states convert a portion of Medicaid funding into block grants. This will have a devastating impacts on health reimbursements and Indian country. It also violates the trust responsibility of the U.S. government to provide health care to our people. The amount of Medicaid service costs paid by the federal government is set by law at 100% for IHS and tribes, but not for UIOs, because UIOs did not exist in law when the law was written. Therefore, we ask that you correct this problem in FY21, as the new block grant funding requirement has made 100% FMAP a more urgent need. We are thankful that the recent budget measure included a substantial boost of funds to cover the costs of the 105L lease obligations in the amount of $125 million, which is $89 million above the FY19 enacted level, and we are hopeful that this funding continues to grow with need. UIOs are not eligible for IHS for these leases, yet IHS has taken $1.5 million from our funding for these leases. We respectfully request language that would restrict IHS to take UIO designated funds for their purpose that cannot benefit UIOs. Every dollar counts for UIOs, and their money must be reserved for them. We also urge the committee to support the reauthorization of the Special Diabetes Program for Indians, SDPI. SDPI is critical to urban Native communities who experience a higher prevalence of diabetes and a greater diabetes mortality rate than the general U.S. population in those areas. It is imperative that the SDPI be reauthorized before its expiration in May 2020. We again thank Chair McCollum, Ranking Member Joyce, and the entire subcommittee for your efforts towards prioritizing funding in Indian country and for holding this hearing. The NACUI staff is available for any questions or other needs for this committee. Thank you.
Okay, I'll start off. I got a little bit of hoarse throat there, but I'll give it the good old Northwest best we can there. So, well, good morning, Chairwoman McCollum and Ranking Member Joyce, and thank you, Subcommittee Kilmer, Simpson, and Ms. Watson. My name is Greg Abrahamson. I serve as Vice Chair for the Spokane Tribe, and I'm on a National Tribal Budget Formulation Work Group, Vice Chair of Direct Service Tribes, and I serve as Secretary for the Northwest Portland Area and Health Board. The Northwest Portland Area and Health Board works with 43 federally recognized tribes in Idaho, Oregon, and Washington to advocate on specific health care issues. I thank the subcommittee for the opportunity to provide testimony. Within the past 40 years, Portland area tribes have made progress to improve the health status of our people, but there's not enough funding to address all the health disparities our communities are experiencing. We are grateful for the increase of the IHS budget. We need $37.6 billion for full funding to meet the trust and treaty obligations. We know the subcommittee has been supportive of increases every year, so we thank you for this, and especially funding for CHRs and health education in FY 2020. For FY 2021, the IHS budget must be brought up $9.1 billion. Per the recommendation of the Budget Formulation Work Group, there must also be an annual increase to population growth and inflation estimated at $200 million. The increased cost of Section 105L leases will continue to cut into program increases for direct service tribes and tribal facilities and will not be able to maintain current services. Section 105L lease costs must be made an indefinite discretionary appropriation. Other funding priorities for our area include mental health, substance use, purchase and referred care, HIV, HCV, Indian health professions, CHAP expansion, and ITHR modernization. For our youth are precious to our communities and the carriers of our Northwest traditions and culture. We wanted to ensure that they all have the services that they need to grow and develop into future leaders for our tribes. With the high rates of native suicide, substance use, and our tribes have prioritized the need of youth residential treatment centers that provide aftercare, transitional living for both substance use and mental health. While there are 2 facilities in Portland area, more are needed with expanded services. For FY 2021, we request increases of $40 million to both substance use and mental health and $150 million for the special behavior health program for Indians. This program holds promise to the tailored and tribal-specific programs that meet behavioral health needs in our communities. As the program is in the pilot stage, it must be expanded beyond opioids and allow the service of other substance use and mental health issues and provide for option for tribes to receive funding through compacts and contracts there. Portland area does not have an IHS hospital, so IHS and tribal facilities in our area must purchase all specialty and inpatient care. There was no increase to PRC in FY 2020, which is a loss in funding when medical inflation is not included. For FY 2021, we request $50 million increase for PRC above the 2020 budget. HIV and hepatitis C funding must also be included in FY 2021 funding. For FY 2021, Portland area requests $25 million for the ending of HIV epidemic and $25 million for hepatitis C treatment so that IHS can begin providing life-saving treatment for American Indians and Alaska Natives within the IHS system. Provider shortages is another concern. The Indian Health Professions Program is critical to support the workforce development needs through loan repayment and scholarships. For FY 2021, Portland Area Health requests a program increase of $10 million for Indian professions. We thank the committee for funding the Community Health Aid Program, CHAP, at $5 million in FY 2020. Our area has made great progress in setting the framework for CHAP expansion. We have 12 dental health aid therapists that have finished the Alaska training program, 1 more graduating from the DHAP program this year. We have 2 in the behavior health aid training program and 6 more ready to start. Our area is already launching a DHAP education program in FY 2021 and is developing behavioral health aid program with 2 of our tribes. In FY 2021, I request $20 million for continuation of the national CHAP expansion with $5 million in Portland area to continue work to establish a demonstration project. Our area has also been advocating for a regional referral specialty center. A study was done in 2009. This would address our area needs related to the specialty care since we have no IHS hospitals. This program can be funded through ICIA Section 143 Demonstration Authority. We also support funding under the small ambulatory and joint venture programs. Lastly, IHS implements the first phases in the IT modernization project. It must continue to conduct tribal consultation to ensure all areas are represented. Portland area recommends funding at $25 million for FY 2021. Thank you for this opportunity to provide recommendations on the 2021 IHS budget. I look forward to working with the subcommittee on the requests, and we thank you for holding this committee, or hold this hearing.
Thank you. Stuck the landing. Ms. Lucero, welcome. Sorry, we're ahead of schedule.
I know.
Yeah.
That doesn't happen
I
often.
know.
And all the time.
I'm going to ask really slow questions when we get to questions.
And it's raining outside. People are behaving like they're driving in Seattle. Anyway, Yatea Bene, everybody. I'm Esther Lucero. I'm Dene and Latina. Third generation of my family to be raised in an urban environment, which is why urban Indian health is super important to me. I'm always privileged to sit at the table with these folks. You know, these are our partners, especially our tribal partners out in Washington. And so it's really amazing to see all of you again. This is now my 4th year, so it's exciting. I feel like we're building relations at this point. I really want to start off with just thanking you all. I think that last year's budget recommendation at $87 million is the highest we've seen come out of this committee, and I just want to say I'm incredibly grateful for that, for the Urban Indian line item. Along with our tribal partners, we have established a funding mechanism to get IHS to full funding within 10 years. And so we really aligned with our tribal partners. And so this year's ask is aligned with $106 million. And I want to be clear, this isn't about taking dollars from our tribal partners. This is about increasing the whole pie. It's very important that we don't focus on percentages, but that we're focused on dollar amounts. The other thing I'd like to thank you for is that we saw $1 million increase going into the tribal epicenters, right? And so if you all recall, the Urban Indian Health Institute is the research arm for the Seattle Indian Health Board and produced the Missing and Murdered Indigenous Women's Report. Now, I will tell you, with little investment into the tribal epicenters, those are the kind of results you will see, right? Actually initiating a national response to this crisis. And so having $1 million increase is really beneficial. And I'll have to tell you, if our 12 tribal epicenters were able to get to a $2 million operating budget per year, we would see significant changes within our community. So our ask is a $24 million ask to go specifically to the tribal epicenters. Let's make sure that we make that investment there so that we can fill the data gaps that you all need to make really informed financial decisions. So that's where I am on that. I think the other thing that we have to understand is that as urban Indian health programs, we kind of rose from the social justice movements of the late 1960s, early 70s, and that means our buildings are getting pretty old at this point. Urban Indian health programs have never had access to facilities dollars. And again, we don't want to take anything from our tribal partners. Many of our tribal partners are still waiting on facilities dollars to address their infrastructure needs. But I will tell you that we actually had an assessment done, and it was my 2nd year, so that would be about 3 years ago. And IHS actually came out to our facility, and they said they were doing an assessment on the needs of urban Indian health programs from an infrastructure perspective. We actually haven't seen the results of that report. My ask to this committee, to the subcommittee, is to ensure that we get the results of that report and that we get to understand what the cost is of making a true infrastructure investment in urban Indian health programs. Now, I'll tell you, HRSA actually did something for the past couple of years where they, as part of their mental health expansion grants, they actually added facilities and infrastructure dollars to that. That's something I'd like to see IHS do, is really invest in what it takes to increase our capacity, both from an infrastructure perspective as we move towards integration, but also capacity in regards to our providers, so that we can meet those needs. And I'll give you a specific example on this. So our Thunderbird Treatment Center, we're actually having to relocate that site, because our building is so old that our infrastructure needs became so significant, and they're very challenging dollars to acquire. And we want to expand our services to provide services to women, pregnant women, women with children. And so we're actually selling that building to be able to use those resources to move. But this is a testament to the fact that we have not invested in infrastructure. And now our organizations, our urban Indian health programs, are going to have to address those needs in whatever way we can. So I want you to know that we're doing our part in creating community partnerships, right? Leveraging our local and state resources, and still it's necessary for IHS to invest in infrastructure. And then lastly, I would ask you to continue to support the work on missing and murdered Indigenous women. You'll hear from my colleague, I believe tomorrow, a little bit more on that work. And to me, this is where that synergy between both, resources, research, and also policy work go hand in hand to support the program needs. Because our communities are struggling with the trauma that these experiences have caused. And so now programs like ours, from a health and human services perspective, are really in need of providing resources and support. And so I would ask that we think about that when we are investing in this year's funding. And with that, it's always an honor to see all of you. It's really a privilege, and I'm sorry that I got a little bit rained out and was a little bit late. No disrespect, I promise. So thank you.
Tough act to follow. No notes. It's impressive. Greetings, Representative Kilmer, Coleman, and Simpson. So honored to be here. My name is Dr. Shaquita Bell. I'm Cherokee and Black. I'm a pediatrician in Seattle, where it wasn't raining when I left, and I heard it was raining here before we left, so we didn't bring the rain. I'm so honored to be up here with the Urban Indian programs. I was a child in Minneapolis who received my care through Urban Indian program, the Minneapolis Health Board, and so it is such a pleasure to be here. I'm the pediatrician in the room, so a lot of my testimony will be pretty kids focused, but I could not agree more with what everyone has said today. I am here on behalf of the American Academy of Pediatrics. I'm the chair for the Committee on Native American Child Health, and I'm also very grateful for our Federal Affairs Office who helped me with this testimony. We at AAP support the IHS full funding that we can get. We recommend the largest possible funding increase. We're also really interested in strong funding, and we really feel like advanced appropriations would be the most helpful thing for IHS. So we also agree with that and strongly recommend it, and we appreciate the efforts of this committee, the subcommittee, to get to that. I like to use stories to tell my desires for funding, and so I'm going to use a story, but I'm going to call this patient Robert. Robert is a young adolescent who would rather play video games than listen to me talk about veggies and eating healthy. He struggles with his weight, and my clinic was able to partner with a local pool, and after exploring his interests, he signed up for swimming lessons and met a group of friends, joined a hip-hop dance club, which apparently is cool as long as I don't talk about it, and has found a really unique way to become physically fit and gain a better sense of identity, which really helps protect his mental health. It's one of the strongest protective factors is a sense of identity. And when we think about mental health and behavioral health in Indian country, we know that we have really vast unmet needs. We continue to have waits as long as 4 to 6 months for acutely anxious patients and depressed patients. I have a young girl who hides under the table at school and cries herself to sleep every night because she's so scared of school, and I can't get her in any sooner than that. So I really urge us to think about how we can address this unmet need in our communities. Once those kids of mine grow up and become students, I love to help have them shadow at clinic and mentor them into their careers. And one of the things that really makes a difference in choosing your future career is loan debt. And so we really strongly appreciate the value of the IHS Health Professions Scholarship Program and the Health Professions Loan Repayment Program, but we really wish it could be tax exempt. That would really help us meet a lot more of the need and recruitment and retention of health providers in our communities, and would take a burden off of students when they're considering this job. So once they become pediatricians, hopefully they all do, then we encourage them to come and work in IHS or in urban health programs or in tribal clinics, and then they get to meet the federal government. It's a real barrier to hiring talented physicians. I have a friend right now who accepted a job in IHS about a year ago and is still working on the paperwork and has sold a house and is trying to move to that community but can't qualify for a loan because they don't have proof of employment. It's just a vicious cycle. And if we can't recruit talented professionals, we're going to continue to have issues with the type of care that we're able to deliver. Kind of thinking about that quality care that we want to deliver, I am very thankful to this committee for hiring the maternal child, or helping IHS to encourage IHS to hire the maternal child health coordinator, Dr. McKiernan. We are thrilled to be partnering with her. She's attended some of our meetings and is already getting on the ground with emergency services, so really thank you for that. Just in closing, every year as part of our committee, we get to visit an IHS site one of the regions, and then we pick 4 sites in that region. And I was fortunate enough to visit the Indian Health Center of Santa Clara Valley, and they told us about a really exciting job skills program where they take youth and teach them skills that they can use for the rest of their life. And it makes me think of Robert, it makes me think of all of the stories that I've told so far of how we can engage youth with really simple interventions that tie them to their identity, tie them to their roots, and lead to a very successful, happy, and healthy life. So with that, I'll close and just thank you all, and be happy to take any questions.
Thank you all for your testimony. Mr. Simpson.
More thoughts than questions. Always a complex problem, but Ms. Rosette, in addition to increased budget line item for urban health, your testimony mentions a number of authorizing issues outside of this subcommittee's jurisdiction. So are you making any progress with the authorizing committees? Because at some point in time, it always comes down to us to do authorizations, and people hate that. So we need to be working with those authorizing committees, so I appreciate that. And Ms. Lucero, you mentioned that in your testimony, the Seattle Indian Health Board's budget has increased by 80% in the last 4 years, which is kind of surprising. At a time when urban Indian organizations are struggling, what is happening in Seattle area that has enabled your budget to grow so strongly?
Yeah, thank you for that question. We're actually very proud of that. So I've been in my position for 4 years now. And for us, we were able to see kind of the low-hanging fruit in places that we hadn't invested. And quite frankly, that investment has been largely in behavioral health. So we were able to access other grant funding sources to be able to supplement that work. Coupled with the fact that we've done significant investment in our infrastructure to support increased revenue through third-party billing. That, of course, is threatened constantly when we hear things like block grants that come into the states that would actually capitate Medicaid dollars. So thank you for that. Yes, we're proud of that. Yes, it's taken a year of, we've had to revamp our entire IT system. We've had to improve our electronic health record system. We've had to access grants and increase staff to be able to support that work. So we are looking at our IHS dollars to maintain our cultural integrity. You know, we can work with these other systems, absolutely, but this is what allows us to serve in a culturally relevant way. And quite frankly, our success is grounded in our Indigenous knowledge-informed systems of care, so centered on traditional Indian medicine. Thank you.
Thank you. Congratulations on that also. Dr. Bell, just out of curiosity, it wasn't part of anybody's testimony, but I was curious, where are we? Are we making progress in diabetes? With the Native American population? As you know, they have the highest rate of diabetes of anybody. And
yeah, I mean, so I'm a pediatrician, so I can. I'm
You're
a
a doctor.
pediatrician, so I can. I would say that we have definitely seen impacts from SDIP. I think the Special Diabetes Project, what it really does, or what that funding does, is allow us to build culturally relevant programs like exercise, diet, nutrition, things that meet people where they're at. The other thing that's really cool about SDIP is that it allows people to be creative. So you don't have this, you know, just, okay, everybody on with diabetes gets X, Y, and Z. You get to tailor it to the community you're serving, and that's why it's so important that each of those communities can take that money and build a program that's specific to their needs, to their people, and to their rates of diabetes specifically. I would have to say across the board, Native or non-Native, we have a problem with diabetes, and that's not Native specific. I think that's a reality for all of America.
Well, I noticed when we've traveled out to some of the reservations and so forth, one of their programs has always been try to get people back on traditional foods.
Yes, absolutely.
And the thought was that would help with reducing the rate of diabetes and so forth. And I was just wondering if there was if we have any positive successes in that we can relate to.
Answer one.
Sure.
From what we learned in the last year is that the mortality rate for natives obviously is lower, but actually with the SDPI program we've increased by 1 year, so we've gained 1 year, so we can that is one success for us.
Yeah.
And that's taken over 20 years to achieve, so that's why we need the continued funding for the SDPI program.
Thank you all.
Mrs. Watson-Colden.
Thank you. I don't really have a question. I just wanted to thank you for your testimony and to let you know that this discussion about the access to health care, about access to mental health care, about cultural competence in services and programs is something that I hear in other specific communities, and it's something that in general we need to pay better attention to. I thank you for the information you shared with me. Maternal health issues, and all of those issues are things that I've encountered in other meetings. So I was very interested in hearing it. Thank you. Thank you. Yield back.
First of all, thank you for your testimony and thank you for the important work you do. I wanted to touch on several of you in both your testimony and your written testimony referenced the impacts of shutdowns and referenced the potential value of, as our chair has led the way on doing advanced appropriations. I think it'd be helpful if you could just paint the picture, though, of when there is a lapse in funding. What does that mean in terms of access to care, quality of care? Help us tell the story to our colleagues. What do you see when that happens? I will say up front, I think there's agreement, certainly by the members on this committee, that trust responsibilities and treaty obligations should not be treated as discretionary. They are not discretionary. And but when you see this lapse in funding, paint the picture for us.
Well, last year I know that in the Boston area they had to shut down, and they in that process they had a couple of people who overdosed, and so that's just there. And in particular for us, for the Native Project, we were looking at the potential of having to reduce hours, which means you have to have less services and less access to the care. So obviously, we had a little bit more. We were more prepared for it, I would say, but not all of our urbans were prepared for it. So what I know was Boston was one of the ones most affected by it, and they saw serious, they saw deaths because of it.
If I could, no, you go ahead.
So within our area there, we had we didn't shut down, but some of them were contemplating on shutting down there. And I believe we did lose one provider in the area there. And as you guys know, that the lack of recruit and retention that we have in the systems there, and I sit on direct service tribe, so on the average, we're 33% of lack of professions in the field there and stuff there. So losing professionals is really critical for us too, and because just being able to recruit them and get them there, and as we heard on testimony here too, there that it takes so long to go through the process of getting them there, but it has made an impact on bringing professionals there and stuff there. So,
yeah, thank you.
For us, we actually had to develop a furlough strategy. And, we always have looming threats both on the community health center side and the IHS side. But for us, we actually had to shut down our Saturday clinic. And we also had to cut back for our elders program, which is largely dependent on our Indian Health Service funding. Additionally, all of our traditional Indian medicine services are funded through Indian Health Service. Those are all the pieces that go away when we have to respond to a shutdown. And so, yes, I've always been a proponent of advanced appropriations. From my perspective, we've already paid this debt, right? We've already paid this debt. And it's up to us to make sure that we help heal the communities that we serve.
Can I share a story that'll be very poignant for you to pass on to your colleagues? So one of the privileges of being chair of CONACH is I get to connect with pediatricians and pediatric providers all over the country. And so when the shutdown happened last year, I sent out an email and just asked how people are doing. And I heard from a pediatrician in the Southwest who were lacking basic medical care for children. So when a baby is born, we check their oxygen level to see if they have a cardiac defect. They could not afford the probe to check the oxygen saturation, right? Because all funding stopped.
Explain what the probe is.
The probe is literally just it looks like a piece of tape that goes to a machine that tells you what your oxygen level is. Like if you've ever been to the doctor, they check it when you check in. So they couldn't get any more of those. So they couldn't screen babies for congenital heart disease, which means until they're seen in their pediatrician or family medicine clinic, we don't know if that child has a heart condition. And that happened, how long were we closed? A month? I mean, a month of babies who were impacted by this. And they were desperate. There were people who were buying supplies for their clinic out of their own pocket. So it was a very, I don't like to use the word devastating, but there was a very real impact. As far as I know, no babies passed away, but if you can imagine as a parent, you'd want to know if your baby's heart was okay.
Oh, thank you. I yield back.
Mike didn't have any questions?
He already
has. Okay, well, thank you very much, and we'll have our next panel come up, and thank you for your testimony. I've read it and highlighted it through the book, so thank you.
Yeah. Sorry I didn't get to tell my Minnesota joke.
Oh, okay. We're running about 10 minutes ahead of schedule, so we want to make sure that we don't miss anybody coming in. So we'll just take a few minutes and take our time. Thank you. Would anyone like any water or anything? You're all good? Happy to get you some. Yeah. Yeah, and we know one of the testifiers was at another meeting and could be trapped in the line, so we'll just wait a few more minutes. Give you a second.
We slowed it down so you could get through security. Yeah.
So good morning. Before we start the panel on climate change, I'm just going to repeat myself about something that I said earlier this morning in the opening statement. For fiscal year 2020, Congress, we included additional funding to BIA natural resources management programs, including increased funding for tribal climate resilience, endangered species, and water resources. And I was disappointed, but not surprised, that the President's budget requests yesterday once again ignore climate change. No one is immune from climate change, especially not Native Americans, who are at the forefront of this experience with the effects on increasing temperatures and rising waters. Your written testimony and other tribal members who spoke on other issues also alluded to what was happening with climate change. Described melting permafrost in Alaska, the loss of traditional foods, concern about traditional and cultural practices, and then we know about the unprecedented flooding that's happening right now in Washington and Oregon. And yet, unfortunately, the President looks the other way. But as I said, The President proposes and Congress disposes. So this testimony that you're about to give on climate change is something that we will be looking at very seriously on how we can work with you for resilience and other issues affecting, that are being affected by climate change. So I'm going to have you introduce yourself and then go right into your testimony. For just a little reminder, you have 5 minutes. Your testimony is fully entered into the record now. So don't feel rushed. Don't feel you have to cover everything. If something comes to mind while you're testifying, the light will go yellow at 1 minute. When you go a little beyond that 1 minute, kind of tap with the gavel, and then at 5 minutes it will go red, and we would ask you to conclude your remarks. So with that, I would very much like Ms. Nelson to lead us off. Thank you.
Madam Chairman and all the subcommittee here, I thank you for being here to listen to us. I thank you as a chairwoman. I'm chairwoman of the Showater Bay Tribe. I'm also a steward, and that's a steward of the ocean and what is happening to it now. I speak for tribal members all along the Salish Sea. We are in danger. And also the whales, the salmon, all the things that live in the sea are affected by what's happening. There is climate change. I'm 80 years old, and I've seen climate change. And at first, it's just part of life, and then all of a sudden you realize something is happening. Our reservation, Showater Bay Reservation, is on right on the edge of the sea. We're 6 feet above high level of the tide. If there is a storm, generally comes up. We work to protect our land. We work to protect the land of the people around us. There are no fences. If somebody needs help, we do help, because that's what you do. I look at what we face, and we're working at trying to go uphill. It's expensive to go uphill. We've bought the land, but to get there is going to be a challenge because the road that's strong enough to carry the equipment goes over a wetland, and you have to mitigate for a wetland. So we're doing that. We're working on doing this. December, 5 days before Christmas, we're protected by a berm, a sand berm out in front of us, and that berm breached, or very close to a breach. I called a state of emergency 5 days before Christmas, and the next morning, the Army Corps of Engineers was out there, and there's boots on the ground day and night to save. They are great. I mean, they have just helped us so very, very much, and giving us advice and good things like that. Coming to meetings, because we hold meetings not only for our tribe, but we include the county, the state, and all the people around us, so that we're working together, because you can't just fix a piece and stop a piece. You have to stop our work on it all, seeing it as a whole, because that's what it was made as a whole. Right now, we actually had another storm Friday night. We have drones, or one drone, that flies over it so that we, after a storm, as soon as it calms down enough, then we can use it. We send that drone out. So we're keeping all the time what's happening. Anyway, as far as reservation lands, we are working on, well, what we did is we purchased from someone else wetland, more wetland, and we're working on doing a wetland bank. Part of this, to begin with, is the ghost dike, which we will, once we're able to, and we've been working on this from 2017, I called a government to government, sat down with everybody, and that's what you do. You sit down, because you're pulling together if you're sitting down, and you're listening. And we showed them, actually took them out in the rain and wind to show them just exactly what we were talking about. It made a difference. We have been moved up in the queue, and we were notified about a week ago. We will be able to apply and start work on the first one, which is a ghost dike. When we breach this, the salt water will come back in. The salt water was there before the owners that, in the 30s possibly, maybe the 40s, built a dike right on the ocean side. So that will bring an estuary, which is important for salmon. Again, we're stewards. We need to look after what we've been given as a tribe and all the tribes around us. Talk about traditional food. Traditional food is salmon in our area. I, in my life, have been a commercial fisherman, a teacher, and now I'm a tribal chairwoman. It's challenge all the time. You keep moving. Keep doing what you like to do, no matter if you get to be 80, which is a gift. But we look at if a tsunami hits is another. That can happen anytime. People say, oh, no, it won't happen. We know it happened in Japan. We set up a command center, and we were ready to go uphill if we had to go uphill. We are working on a tsunami tower. The tower is where the middle of the peninsula is, and that will be where people, the only place that people there can get in time is to that tower. It's open to everybody. It's our tribal members. It's anybody who's down there. Get there as fast as you can. Well, we're working on that because we found out there's some wetland under that. We're working with FEMA with this. And it's important we want to get that built. We need wetland credits in order to do that. So that we're getting the wetland credits, we hope, with our bank and or the Ghost Dike Bank, and we can move up, start our move uphill. We've got the plan for the road. We just can't get the money yet or the road. And we've put our own money into doing what we've been doing. And by the way, I'm blind, and I in my right eye, and I am using my left eye to try to look at people, and I see I'm red. So anyway, that's where we are. We're working, and we have, I always think we go in and we say, we're going to look at this, we're going to make a plan. When is it too late? When is it too late? And I want to get there and do something before it's too late. Masi. Masi, by the way, means thank you.
All right. Thank you, Chair Nelson. Madam Chair, members of the committee, it's an honor to be here today. For the record, I'd like to apologize to Congressman Kilmer. I missed the 10 most enlightening minutes of my life this morning, apparently. He gave a speech over at NCAI, is my understanding. But sorry I couldn't be there. Yeah. So.
We'll get you a copy.
Yeah. All right. Well, I'm the TJ Greene. I'm the chairman for the Makah Tribe, and I'll be testifying on changing ocean conditions and severe water shortage that we have on our lands, and tsunami relocation efforts, oil spill response and prevention, as well as coastal erosion, some of the things that was already discussed here today. And the Makah Indian Tribe, we're located at the northwestern tip of Washington State, right where the Pacific Ocean meets the Strait of Juan de Fuca. Real beautiful area, and the ocean means everything to us. It's what our treaty is built around, and it's what defines us as a people. Tribal fisheries are vital for Makah culture, subsistence, and our economy. The impacts of changing ocean conditions on our fishery is a priority for the Makah Tribal Council. We're already experiencing warm ocean waters, increased hypoxia, harmful algal blooms. Ocean acidification along our coast is putting our treaty resources and our community at risk. Continued funding for federal programs like BIA's Tribal Resilience Program and EPA's National Estuary Program is crucial to addressing climate change and protecting our community and livelihoods. In this past decade, Makah has experienced 3 fisheries disasters due to changes in the marine environment. Fisheries disasters hit our community particularly hard, and delays in disaster relief funds compound these effects. We appreciate that they do eventually come, but the delays in the process are critical to our fishermen to, I think we can do that a little bit better. We urge Congress to continue to designate funding to National Fisheries Disaster Account, as it has done in fiscal years 18 and 19, and to expedite fisheries disaster relief in this process. Over the past 2.5 years, we have trapped over 2,200 invasive European green crabs on the Makah Reservation. My backyard, which you've been to, Congressman, is one of the sites that's being infested by these green crabs. We're the only entity monitoring the outer coast of Washington. Limited available resources are targeted in the Puget Sound. We need increased federal funding to address this infestation through monitoring programs on the outer coast, possibly under the U.S. Fish and Wildlife Service, an aquatic invasive species program. These crabs compete with some of the habitat that is critical to the Dungeness juvenile crabs that are very important to Washington State, and we think that's important. We have severe water shortages on the reservation. Due to limited groundwater storage capacity, the Makah tribe experiences chronic and severe water shortages every summer, which are exacerbated by climate change. Water shortages restrict our tribe's ability to provide sufficient housing for our community and limit economic development and relocation efforts. We request federal funding increases for programs like IHS and BIA to address water shortage issues on tribal reservations. We also would like tsunami relocation efforts to be funded. The Makah Village, including 60% of our population, our schools, clinic, and all of our critical infrastructure, including water treatment and sewage treatment facilities, are in the tsunami inundation zone. We're developing a comprehensive relocation plan for our community, but planning and implementation is restricted and limited by water supply and lack of funding. We want to work with programs like IHS, HUD, BIA, and others to identify solutions and funding opportunities to address this imminent threat and move our community to safety. Oil spill preparedness and prevention infrastructure is something we've been involved in heavily for years. Since the 1970s, over 1.5 million gallons of oil have been spilled within the Makah Treaty area, which is vital to our fishing resources, the staple of our economy. The Strait of Juan de Fuca is a high-risk area for vessel traffic where ocean and weather conditions are often severe. Vessel traffic is increasing, and climate change further complicates spill response on the remote outer coast. Because of these risks, the Makah tribe is highly engaged in oil pollution, vessel traffic safety, and climate policy forums, supported by EPA's National Estuary and Brownsfield programs. It's essential that these programs continue to fund and prioritize tribal engagement in this area. The Port of Nia Bay is home to an emergency response towing vessel, ERTV, which has made over 70 saves since its stationing, preventing oil spills across the outer coast of Washington and British Columbia. The tribe has already invested $13 million of its own funding for infrastructure in the Port of Nia Bay. And coastal erosion is threatening 2 primary areas in our territory. Hobuck Resort, which is an economic employer to the community, and the Ozette coastline, which is vital to our cultural resources. There's a significant amount of erosion that's going on in those areas that are at risk, and we're looking for programs to help mitigate those risks. Thank you for the opportunity to testify today.
Thank you very much. Mr. Williams.
Yeah, my name is Michael Williams. I'm currently the chief of the Akak Native community in Western Alaska. Impacts on Alaska Natives and American Indians. Climate change is undermining the social identity and cultural survival of Alaska Natives and American Indians. As we watch our ice melt, our forests burn, our villages sink, our sea level rise, our temperatures increase, our oceans acidify, and our animals become diseased and dislocated, we recognize that our health, our traditional ways of life are at risk. Our elders in particular are deeply concerned about what they are witnessing. In Alaska, unpredictable weather and ice conditions make travel and time-honored subsistence practices hazardous, endangering our lives. According to the U.S. Corps of Engineers, at least 3 tribes must be moved in the next 10 to 15 years: Shishmerf, Kavlina, Newtok, while according to a GAO report, over 100 communities are at risk. Currently, Newtok has begun to move, finally. Everything is changing so quickly. Lakes are drying, new insects are appearing, permafrost is melting, berries are disappearing, storms are fiercer, animal populations are changing, our fish are rotting on drying wracks, polar bears are drowning and dying. Everything, because of massive record-breaking forest fires, our youth and elders are having trouble breathing. Our ice is so much thinner or entirely gone. And our coastlines are eroding, washing away ancient artifacts from our ancestors as well as modern infrastructure. Throughout the nation in Indian country, traditional foods are declining, local landscapes are changing, rural infrastructure is being challenged, soils are drying, and lake and river levels are declining. Tribes are experiencing droughts, loss of forests, fishery problems, and increased health risk from heat strokes and from disease that thrive in warmer temperatures. If climate change is not addressed, the impacts on Alaska Natives and American Indians will be immense. Models and the best scientific data and traditional knowledge indicate that if we do not reduce greenhouse gas emissions, the entire ice cap will melt, endangering the culture and subsistence needs of America's indigenous people. Furthermore, erosion, flooding, sea level rise, storm surges, and greater storms will endanger my people, the Yup'aks as well as tribes in Florida or elsewhere. Hotter temperatures threaten all indigenous people, especially in the southwest and Florida, where we often do not have adequate means of escaping the heat. Increased climate change will also endanger salmon in the Pacific Northwest, even in our lands that we witnessed this past summer, which are crucial to the tribes there as well as in Alaska. Finally, on almost all tribal lands, enhanced climate change will threaten our sacred waters, essential to our physical and cultural survival. Clearly, climate change presents one of the greatest threats to our future and must be addressed by Congress and the administration as soon as possible. We cannot afford to wait any longer. We cannot put our head in the sand right now. And we have so much opportunities that we can initiate now with economic development other than the fossil fuels that we depend on. We can get our economic opportunities without depending on fossil fuels anymore. And we, as Alaska tribes and corporations, have passed resolutions indicating our impacts on our river, on our oceans and our rivers. Alaska Federation Natives, NCAI, and I had an opportunity to listen to you this morning, and thank you for those comments, Mr. Kilmer. But anyway, throughout the Alaska Nation, we are in peril from climate change. For the sake of our children and grandchildren, 7 generations and beyond, Congress must take meaningful action to address this issue right now. Thank you.
Thank you, Mr. Masego.
Good morning, Chairwoman McCollum, Ranking Member Joyce, and honorable members of the subcommittee. My name is Robin Littlewing Saigo, and I serve as the treasurer of the Suquamish Tribe. Thank you for the opportunity to testify about the tribe's funding priorities. The Suquamish name comes from the traditional word Dasukwab, which means place of the clear salt water. The tribe is a signatory to the 1855 Treaty of Point Elliott. Our reservation, which is located west of Seattle across the Puget Sound, encompasses approximately 7,600 acres, including 12 miles of Salish Sea shoreline. The Suquamish people have lived in the Puget Sound area since time immemorial. The tribe relies on its abundant wildlife and plants to meet our economic, nutritional, and cultural needs. These traditional foods are found on our dinner tables and featured during our tribal gatherings. Today, 20% of the tribe's members help support their families by earning income from the harvest of fish and shellfish. With such strong ties to our environment, the Suquamish tribe is experiencing the growing impacts of climate change. The tribe is on the front lines of this battle, and one which is disrupting our daily lives. In order to aid tribes facing climate change, the Suquamish tribe requests the subcommittee increase funding for the BIA's Tribal Resilience Program, or TRP. Despite the tribe's best efforts, we are facing an uphill battle against climate change. We feel stronger federal investment in programs such as TRP is needed. Over the last several years, the tribe has received multiple funding awards through TRP. With this funding, the Suquamish tribe conducted a project that provided us with valuable data on the temperature and stream flow of the Chico Creek watershed. For generations, my family has lived on this watershed, and we have witnessed the decline in returning salmon. Thanks to the TRP funding, the tribe is now able to monitor future changes of the watershed, which may cause long-term impacts on our salmon population. Another TRP program was centered around engaging our tribal youth in understanding the impacts of climate change at a scientific and cultural level. By laying the groundwork of knowledge for our youth, we are providing them with the best tools to continue this battle against climate change. The TRP has proven to be an effective program to help tribes fight against the ever-increasing impacts of climate change. Therefore, the tribe urges the subcommittee to consider a substantial increase to funding for TRP. The tribe's second request is for continued funding for the U.S. Fish and Wildlife Services Tribal Wildlife Grants. The Suquamish tribe has been active in the recovery of the sea cucumber population in the Puget Sound. Due to over-harvesting, many areas where the sea cucumber once thrived are now struggling in population number. The sea cucumber is part of the Puget Sound's rich community of organisms, and the tribe is committed to ensuring all wildlife within it thrive. The Suquamish tribe received a tribal wildlife grant to help protect future generations of sea cucumbers. With this important grant funding, the tribe partnered with several organizations to start a sea cucumber restoration program. The project focuses on over-harvested areas in the Puget Sound and created a hatchery program. This funding will help to reintroduce sea cucumbers from the hatchery to some of our most over-harvested areas. And I have gotten to go visit those little baby sea cucumbers, and they're really cute, and they just keep getting bigger, and some of our elders go out and look at them also, because that's an important part of it as well. The Suquamish tribe urges the subcommittee to continue to increase funding for the tribal wildlife grants and also expand it to include more pilot programs. And finally, the tribe's final request is for continuing funding for the EPA's Puget Sound Geographic Program. The EPA's Puget Sound program provides funding to tribes to address environmental and human health risks, as well as tribal capacity building and project implementation. Despite the effectiveness of the Puget Sound Geographic Program, the EPA's fiscal year 2020 budget request calls for its elimination. Considering the proposed elimination of the program, the Suquamish tribe was pleased to see the program increase to $33 million. However, the Puget Sound program has suffered a drastic reduction in funding from the $50 million it previously received. Therefore, the tribe encourages the subcommittee to continue funding and increase the funding available for the EPA's Puget Sound program account. Thank you for this opportunity to testify. This work here is more than just food. It's also about our culture. It's also about the whole world. And I'm available to answer any questions.
Thank you. Ms. James.
Chairwoman McCollum, Ranking Member Joyce, and members of the subcommittee. My name is Gina James. I'm the first councilwoman of the Quinault Indian Nation Business Committee. I want to thank the subcommittee for holding this hearing to hear from tribes on the importance of these federal programs. Before getting into the specific requests I would like to thank the subcommittee for increasing funding for the Bureau of Indian Affairs and the Bureau of Indian Education in fiscal year 2020 by $142 million over fiscal year 2019. The subcommittee also increased funding to the Indian Health Services by $243 million over the 2019 enacted level. Thank you. The Quinault Reservation is located on the southwest corner of the Olympic Peninsula in Washington State and abuts the Pacific Ocean and has over 3,000 enrolled tribal members. The lands and waters of the Quinault Reservation consists of 207,150 acres of beautiful forest lands, mountains, rivers, Lake Quinault, and 25 miles of relatively undisturbed Pacific coastline. My testimony today focuses on 3 priorities. Funding requests for the Tohola Village relocation project. There are 2 major villages located within the reservation, villages of Tohola and Queets. Tohola is located in the southern portion of the reservation at the mouth of the Quinault River on the Pacific coast and consists of 2 locations known as the Upper Village and the Lower Village, the latter of which is located below sea level and is the original village of Tohola, signers of the Treaty of Olympia. Our nation has models prepared by the Washington Department of Natural Resources that show a potential of a tsunami inundation of 40 to 50 feet in depth in most of the lower village of Tohola, and that's where I live. A comprehensive 2017 report was contracted by QIN and 2 other tribes, the Quileute and Hoh Indian tribes, to understand the effects of climate change and impacts to the homelands and treaty resources of our coastal tribes. The report, entitled Climate Change Vulnerability Assessment for Treaty Tribes of Olympia, found that the combined effects of thermal expansion of ocean waters, vertical land deformation, e.g. tectonic movements, melting glaciers and ice fields, and seasonal water surface elevation changes due to local atmospheric circulation effects will result in sea level increases, substantial increased flood risk in the lower village of Tohola. By 2050, sea level is projected to increase by up to nearly 20 inches under the high scenario. The report further noted that changes posed by climate change include increased winter precipitation, soil saturation, and flow into the Quinault River, will compound and increase the coastal flood risk to the lower village of Tohola. The nation applied and received a grant in 2013 from the Administration for Native Americans, U.S. Department of Health and Human Services, to prepare and plan to relocate the village to higher ground, and it resulted in the Tohola Village Relocation Master Plan. We will need assistance from our trustee, the federal government, to continue implementation of the master plan and to ensure that our citizens are safe and our government operations continue. We request a subcommittee in the fiscal year 2021 appropriations bill direct the BIA and the Environmental Protection Agency to prioritize funding for tribes who are dealing with reservation loss and displacement due to climate change. We also urge the subcommittee to include report language that mandates funding criteria that will allow our tribe and others dealing with the negative impacts of climate change to address the needs described above. Along with the climate change and the more rain in the winter, another funding request is for additional road to access Quinault's village of Tohola. Exit and entry access to the village of Tohola is limited to a single highway. Access to the village is cut off during natural disasters and weather events such as downed trees, mudslide, floods that make the roads impassable. In December 2018 and January 2020, very large mudslides shut down the single highway for a number of days. When this access is cut off, emergency vehicles are unable to reach or leave the village of Tohola except by a treacherous logging road known as BI Road 29 or McBride Road. It takes an additional 45 minutes for 15 minutes to get through that road. That significantly increases response times for emergency services. We thank the subcommittee for funding the BIA road maintenance program at $36 million in the fiscal year 2020. We ask that the subcommittee increase funding for this program to $50 million to meet the current high demand of tribes. We also urge the subcommittee to include report language giving funding priority to tribes with safety and emergency access concern. And my last request was the housing improvement program.
Have that, yeah.
QIN has utilized this program for many years. HIP is a home improvement and home replacement program that assists tribal members who have substandard to deplorable housing. Cutting this funding would be devastating to the people that need it the most. We thank the subcommittee for not following the administration's request to zero out and cut this program and for funding it at $11.7 million in fiscal year 2020, an increase of $2 million for fiscal year 2019. Because there is a continued need for this program at Quinault and through Indian Country, we ask the subcommittee to increase funding to $15 million for fiscal year 2021. Thank you for allowing me time to comment on our nation's needs and other Native nations.
Thank you. Thank you for your testimony. It was heartfelt and disturbing. Mr. Kilmer.
Thanks, Madam Chair. And I actually just want to start by thanking our chairwoman and our ranking member for coming out to our neck of the woods this last summer and seeing some of the challenges that you spoke to. We had Councilwoman James, the Quinault, hosted 4 of the coastal tribes for kind of a roundtable discussion around some of the challenges facing frontline communities. And we got to go down into the lower village, and it's one thing to hear about it, it's another to kind of put eyes on how close the ocean is and to be below sea level and to actually see the risk of climate change on your village. We heard from the Makah tribe about some of the challenges faced by climate change, not to mention the threat of tsunami. One of your neighboring tribes, the Ho tribe, spoke to the fact that while they had secured space to move to higher ground and had built a fire station, the only supplies they were able to secure at this point were body bags, which was a pretty dark statement. I thought it was a good thing that Chairman DeFazio and the infrastructure proposal or framework that he put out had a section that was focused on resiliency. Personally, I think that we should have a section that's dedicated to tribal communities and specifically to frontline communities that are going through what you're going through right now, that are facing the need to potentially move to higher ground. And I was hoping that you could just elaborate a little bit on what are the big hurdles that tribes are facing when you talk about moving to higher ground. There's a lot, and Chairwoman, you spoke about, the road problem and dealing with wetlands. It's a lot to think about just in terms of basic infrastructure like water systems and sewer and all of that. Can you just speak a little bit about what are some of the barriers that this committee should be thinking about when it comes to moving to higher ground?
I think you said it already. One, money to do these things. The infrastructure when we get up there, and we're planning that, but we don't have money enough to do it for sure. Time is getting shorter, and I know that all of our fellow tribes have the same problem. We don't have enough money to build the houses, do the infrastructure like it should be done because we want to do it so we're environmentally, taking care of the environment, and we're doing as much as we possibly can for the people around us to keep them safe too.
Yeah, in Alaska, Mr. Kilmer, right now in my village, we are relocating 6 homes right now, and we're struggling to get funding. And we appreciate all of the contributions that we had because of the disaster nature of what we are facing. And many of the communities are falling into the river, and because of the permafrost melting, and a lot of the roads and a lot of the buildings are tilting and falling down, and a lot of our graveyards are sinking into the tundra. And it's just, I think FEMA and federal agencies need to come together. Army Corps of Energy Engineers, everybody has to come to aid the communities that are being impacted by the climate change that we are facing. It's not our fault that we are living in these conditions. It is the emissions. It is what is going on in other parts of the world that are affecting the Arctic. And it's not going to be the same anymore. And we definitely need Congress and the administration to help give us the relief right now. Really appreciate it.
Congressman Kilmer, if I could just add that some of the wetland mitigation is an issue for Makah as well, and then also the funding to be able to access some of these areas out there where we live. The places we need to relocate to are not easily accessed. There's no infrastructure in place in terms of roads, water, sewer. Those sort of issues are not there. The tribe's invested over $7 million in the last 10 years to move to some of these areas and put housing developments in some of these areas, relocate part of its health facilities there, and is planning to relocate the rest of the housing facility. That's going to be about another $7 million investment by the tribe that we're going to do. We're moving forward with it. And so, those are some of the challenges, and just to keep in mind that every time we do that for Makah, we're having to take timber out of our revenue cycle. We're a timber tribe that relies on that for our budget, and every time we have to dedicate this land for other uses, it takes that away from our economy. Thank you.
I would just like to reiterate the point about the infrastructure and the costs for us to move up the hill. And because our reservations are heavily allotted, we might have to get permission from 200 landowners to buy a 80-acre allotment to build a housing development on an allotment. So it takes a lot of time, a lot of calling and visiting and trying to convince people to sell their allotments. And the nation has put money into buying some allotments, but the infrastructure is the biggest cost. And basically moving the ancestral village up to the upper village is going to be hard, because that's where our foundation lies, and where our people were originally signed our first Quinault River Treaty before the Treaty of Olympia was signed with the other two tribes.
Thank you, Madam Chair. I yield back.
Mr. Joyce?
No, I apologize. Thank you for all being here, and I apologize for coming in a little late, but I went over to the National Congress and have returned, and I appreciate your coming here today and advising us so we can make better decisions on your behalf. Thank you.
Ms. Pingree?
No, thank you, Madam Chair, but thank you so much for, I'm sorry I had to come in late, but such an important topic, and we really appreciate your giving us some insights into how to help.
Mr. Stewart?
No, just thank you for coming.
I appreciate you pointing out the interdependency of the federal agencies working together, whether it be Army Corps, FEMA, and disaster mitigation and that. And one of the things that we're going to try to figure out is how we do a whole of government approach to what you need to have happen, and to really get a cost and a handle on this. Because as the other panel pointed out, we are underfunding healthcare as it is right now, and you're going to have hospitals and clinics that are going to have to move through no fault of your own. And we need to start getting real about having a plan about what this is going to cost, how we're going to pay for it, there's just a lot of work to do and time's wasting. But on a different note, this gavel's made out of an invasive species called buckthorn. And I'm curious about what these green European crabs, so we don't want buckthorn. I don't want gavels made out of it. I want it to go away totally. But when you trap these green crabs, are you able, Mr. Joyce and I deal with Asian carp. They don't appear to be good for much of anything, maybe fertilizer eventually. What happens with them? Is there anything that you can do? Can they say they're sorry in any way possible for being there to you?
Currently, there's no use for them right now. Our fisheries program, is analyzing those questions. If they're going to be there for the long term, is there a use for them? We don't have that answer yet, but we're trying to develop that, and certainly it's these invasive species can be devastating.
And so you're monitoring on your area and you ask for more funding for fish and wildlife for invasive species, but is anybody else monitoring, or are there whole sections where no one's really surveying or even paying attention to what's happening with them?
Our understanding is that there's whole sections that aren't being monitored right now, and that there is some monitoring going on in the Puget Sound. I don't know the exact levels of that, but we feel that it certainly needs a little more attention, especially in light of the importance of that region's dependence on the Dungeness crab fishery. I don't know if that's a risk or not. I guess the science will tell us whether that is or not. But
and then I'm going to take the prerogative of being the chair and ask you one more question, because and if the rest of you have timber, please chime in and say anything. With climate change, what keeps you up at night about being able to sustain your economic development with? Is it with climate change, invasive species coming in? Is it water? Is it drought? Is it fire? What is it?
For us, it's the health of the ocean for Macaw. The ocean's a big driver in climate, as we know, and our whole livelihood is built around the ocean, and that's what keeps me up at night, Madam Chair. We depend on that for everything. It's our spiritual identity.
Okay. Well, thank you. Thank you all. We'll have the next panel come up. Gwetch. Well, good morning, and this is our last panel before we will take our break, and it is on land trust and natural resource management. And I think some of you were in the room as the other panel went forward, so I'll just quickly, please introduce yourself, go right into your testimony. You have 5 minutes. We have your full testimony in front of us, So don't feel rushed or that something won't be covered, because it will be read and it'll be used to formulate questions as the other panelists that we will be asking the bureaus about Indian health education and some of the Department of Interior issues. So you're helping us prepare questions from Indian country when we have those testimonies moving forward. Yellow light means you have 1 minute yet left. Red means please wrap it up, and we'll let you start, sir. Introduce yourself and go right into your testimony. Good to see you again.
Good morning, Subcommittee. Bashai Wawas, Nebashai Nema. It's good to be here with you all. My name is Lad Edmo. I'm the chairman of the Fort Hall Business Council and the Shoshone-Bannock Tribes of Southeast Idaho. The Shoshone-Bannock Tribes thank Representative Simpson for being our friend. For almost 70 years, the health and environment and safety of tribal members have been subject to toxic contaminations caused by Simplot and FMC Corporation from mining and processing of phosphates on the reservation and on our ceded lands. This has resulted in 2 Superfund sites. At the Eastern Mashad Flats Superfund site, Simplot currently operates a phosphate facility that contaminates over 2,500 acres. After 30 years, FMC and Simplot have not cleaned up the site. Because of chemical and radioactive contaminants, we cannot drink water, we cannot eat fish, and we cannot swim in the rivers and streams. And recent tests show that our aquifers are contaminated. This must be cleaned up. This past year, the tribes developed air and water quality standards with EPA. It is critical that EPA approves these standards. We ask the committee's assistance in funding for implementation. The Idaho National Laboratory has evaluated the site and determined that there are viable treatment options. FMC removed and shipped some of their waste off site after years of saying it was not possible. We ask the committee's assistance in working with EPA to require actual cleanup of and also funding a pilot project for cleanup of each site. Simplot mined an open pit phosphate operation across 7,000 acres for over 45 years at the Game Mine Superfund site on the reservation. It closed in 1993. Since then, the site has not been cleaned up. In 2010, EPA conducted a remedial study under CERCLA, which found that the soil, vegetation, and surface water remains contaminated with arsenic, mercury, uranium, and other heavy metals. We remain concerned that these contaminants will leach into the groundwater. In addition, the site has approximately 158 open pit mines ranging from 10 to 20 acres, some having high walls over 50 feet, making the area unsafe. We appreciate Representative Simpson's leadership in bringing together the federal agencies, Simplot, and the tribes to work collaboratively on this. We request the committee's assistance to fund a long-term strategic plan for the tribes to return the land to its natural state. I want to highlight our other priorities. We request your support for advanced appropriations for BIA, IHS, programs to uphold treaty rights and trust responsibilities and to protect tribal programs during shutdowns. We thank the committee for last year's support language on the National Park Service proposed rule on the National Register because it would harm our efforts to protect our cultural resources and our federal lands. We request that the committee ensure that NPS conduct meaningful consultation with the tribes before there is a final rule. We are very concerned that CEQ's proposal regarding NEPA, the tribes rely on NEPA to understand the impacts of natural and cultural resources. We ask the committee require meaningful tribal consultation before CEQ does anything else. We need more funding to offer safe, affordable transitional housing to aid our efforts to help tribal members recovering from substance abuse. Our BIE schools lack adequate funding to hire qualified teachers. Entry-level teachers are offered $10,000 less than surrounding schools. We ask for competitive teacher salaries at BIE. We lack sufficient funding for utility systems, for roads, housing, community buildings, and broadband internet, which are important to our future economic success. We urge the committee to provide an increased funding for all infrastructure programs in Indian country and to ensure there are tribal set-asides. Thank you for having me, subcommittee. It's an honor to be here speaking before you.
Thank you. Ms. Dana?
Good morning, and thank you for allowing me to testify today on behalf of the Penobscot Nation. I'm Molly and Dana. I serve as the ambassador. I want to thank Chairwoman McCollum and Ranking Member Joyce for continuing to hold these tribal witness days. It's nice to see you. I also want to thank Ms. Pingree for being a tireless advocate for the tribal nations in Maine. Our relationship with the federal government is complicated, and you've really been a huge help in educating your colleagues about that relationship and advocating for our unique funding needs. Thank you. My testimony today will focus on the need to increase funding for the BIA's fish and wildlife management programs. The Penobscot Nation continues to practice our traditional sustenance lifestyle. Our people continue to hunt moose, deer, bear, and fish for medicinal and cultural purposes. We also rely on access to traditional plants. Every tribal member has the right to acquire one moose per year, and this animal can feed an entire family for much of that year and is supplemented with other game and fish. So having access to these traditional foods cuts down on the cost of groceries significantly and reduces health disparities such as type 2 diabetes amongst our people. Given this, the proper management of our lands, wildlife, fish, and waters is critical to our health and longevity. We have over 123,000 acres in land holdings. Although our lands historically covered much of what is now the state of Maine, our land became substantially reduced and scattered after enactment of a Land Claims Settlement Act between us, Maine, and the federal government in 1980. Our various territories can be a 3-hour drive from each other, and our land base also includes about 200 islands located within 80 miles of the Penobscot River. So most of our land is undeveloped forest land best used for hunting. We have limited economic resources and are not able to conduct gaming like many other tribes. So we really rely on the federal government to meet its trust responsibility to us by providing funds for our natural resource, water, and land management programs. Excuse me. We rely on BIA funding for these programs in particular because those funds are recurring each year. Our current unmet need for our fish and wildlife management programs is approximately $360,000 annually. Additionally, we have been short one full-time game warden for several years now due to lack of funding. As I previously mentioned, our lands are scattered, and most of our citizens rely on hunting and fishing for sustenance. Proper management of our wildlife and lands is crucial to our ability to continue to hunt. Game wardens also play an essential role in ensuring that our wildlife is not over-harvested. They are also the only law enforcement on a lot of these lands and play an important public safety function for hunters who may get lost or injured. We need funding for game wardens to be increased. Unlike many other tribal nations, our Settlement Act requires that all of our trust lands be managed pursuant to the Indian Self-Determination Act. Thank you so much. I have a sore throat. I've been fighting a cold. That's so nice of you. All right, let's talk about self-determination contracts. The Indian Self-Determination Act, which means that we are required to enter into self-determination contracts with the federal government for management of our lands and natural resources. For almost every other tribe, these contracts are voluntary versus mandatory. So for us, they're mandatory. And this means we cannot retrocede management of our lands and resources back to the federal government if the BIA fails to fund our programs properly. This puts us at a disadvantage in negotiations with the BIA on our annual funding agreements. We believe that Congress owes us a unique obligation to better fund our self-determination contracts because of our Settlement Act. Self-determination contracts are funded through the Tribal Priority Allocations line item, and we ask that funding for them be increased. I would like to wrap up my remarks today by providing the committee with an update on the opioid epidemic that Penobscot Nation has been facing for several years now. This issue continues to be our #1 health and safety risk. With the support of this committee, the BIA has been able to hire a drug investigator focused on supporting the tribal nations in Maine. This has helped a lot, and we thank you for getting this to happen. Our biggest need for combating this epidemic is funding for our tribal court, and particularly our Healing to Wellness Court. When we are able to get individuals into the Healing to Wellness Court program, we have made substantial progress in getting them off opioids and back on track to being productive citizens. But our court is overwhelmed right now, and we need additional resources to build up to our capacity. We ask that the committee increase BIA funding for tribal courts. Thank you again for the water and for allowing me to provide remarks today.
Mr. Frank.
Good morning, Chairwoman McCollum, Ranking Member Joyce, and honorable members of the subcommittee. My name is Willie Frank III. My Indian name is Qualashkid, given to me by my grandfather, Willie Frank Sr., who lived to be 104. And I have the honor of serving as a council member for the Nisqually Indian Tribe. I'm humbled to speak today and continue my father, Billy Frank Jr.'s lifelong fight to save our salmon, waters, and the environment. In 1854, the Nisqually Tribe in the United States signed the Treaty of Medicine Creek. Through this treaty, the tribe secured the perpetual survival of our people, our traditions, and our culture. We also reserve the right to use our homelands and access the natural resources that have been central to our existence since time immemorial. However, the salmon of the Nisqually River have dramatically decreased in a number of years. 2 species are listed as threatened under the Endangered Species Act, the fall Chinook salmon and the steelhead trout. 2 more species are candidates for future listings. Our tribe was able to fish 8 months of the year on the Nisqually River, but by 2015, fishing time was constrained to a mere 8 days to conserve the diminishing resources for future generations. 8 days is not using our homelands and water as promised. 8 days is not practicing our culture and our traditions. 8 days is not honoring the promises contained in the Treaty of Medicine Creek. First, the Nisqually Tribe would like to request an increase in funding for the BIA's Western Washington program. The Department of Interior established the Rights, Protection, and Implementation Program to uphold the federal government's treaty obligation. This initiative includes the Western Washington Program, which provides tribes with federal funding to protect and restore for wild salmon and for fishery management. The Nisqually Tribe has used this vital funding to protect our precious fish resources and to build a strong and dedicated natural resource program. The tribe has over 50 staff and 8 different programs. However, the funding levels for this program are not sufficient to face the current challenges. The tribe is putting all its efforts into the survival of our fisheries and stretching every dollar. Unfortunately, the federal resources have failed to fully support the proper management of our treaty-protected rights. The Nisqually Tribe's second request is for increased funding for EPA's Puget Sound program. The Puget Sound represents the promise of a clean, healthy, and vital environment that is central to our lives in Western Washington. However, the Puget Sound is in dire need, and it suffers, so do our salmon. The plight of the salmon is the plight of my people. Losing our promised and generational connection to the salmon, the river, and our traditional practices has long-lasting impacts on our communities. Our physical, emotional, and spiritual health is directly and permanently connected to our river and salmon. Saving the salmon is saving our people. We are not alone feeling the impact of disappearing salmon runs. Our brothers, the orca of the Puget Sound, are salmon eaters like us, and they are now listed as threatened under ESA and are slowly slipping away into extinction. As go the salmon, goes the orca and the Nisqually people. Under EPA's Puget Sound program, the Nisqually Tribe receives funding to conduct research and implement programming to revitalize salmon populations. This funding allows our scientific researchers to understand the underlying issues impacting the Puget Sound. Once we have an understanding of the cause, we can deploy the best measures to protect the salmon. The Nisqually Tribe requests that this subcommittee ensures the Puget Sound remains this year and into the future, Puget Sound program. Finally, the Nisqually Tribe requests increased funding for the BIA Tribal Resilience Program. Climate change is real, and it is having a dramatic impact on our people and the resources we depend on. As a result of rising sea levels, we are seeing changes to the Nisqually Delta in ways that are impacting salmon survival. The culturally important plant species that we use for our food, medicine, and crafts are becoming scarce as their range is being reduced with rising temperatures and changes in timing and magnitude of rainfall. We have invested a tremendous amount of time, resources to protect and restore our watershed, but the changes are occurring in a pace that is challenging to match with our efforts alone. We all need to increase the magnitude of our efforts while working on solutions to the climate change that threatens the very resources that we care for and are dependent on our very survival. In conclusion, I want to thank the committee for listening to my testimony today. And I am a fisherman on the Nisqually River. I fish with my father. I fish with my brother in the same areas where my grandfather fished. And for us being on the river, that's medicine for us as Native people. And the importance of the salmon are sacred to us. I compare it for us to going to church. When we're able to set our nets on Sundays, that's medicine for us. That's a way to express our treaty rights, our tribal sovereignty, and our way of life. And at 82 years old, my father, he was still fishing with us on the Nisqually River. So the importance of salmon are very near and dear to the Nisqually people, and we will continue to fight and protect our treaty resources and tribal sovereignty, and we look for support and funding. I thank you.
Mr. Costa.
Good morning, Chairwoman McCollum, Ranking Member Joyce, and members of the subcommittee. On behalf of the Confederated Tribes of the Caldwell Reservation, I thank you for the opportunity to provide testimony today. I know that you have the testimony that was submitted, but I did make some changes last night, and so I'm going to read that today. The CCT, the Caldwell Tribe, recommends that the subcommittee, 1, provide a $10 million increase to the Bureau of Indian Affairs forestry account for reforestation and additional foresters. 2, include report language directing the Secretary of the Interior to prioritize tribal requests for wildland preparedness funds. 3, and this is a change, to provide a $50 million increase to the BIA forestry account to award grants to tribes in the Northwest region to develop forest health strategic plans. And 4, include report language directing the Secretary to consult with stakeholders, including Indian tribes and tribal organizations, and report to the committee on the potential benefits of using very large air tankers in fire suppression activities. Although now considered a single Indian tribe, the Confederated Tribes of the Caldwell Reservation is, as the name states, a confederation of 12 Aboriginal tribes from north central Oregon to British Columbia, Canada. That's an edit that I added. The Caldwell Reservation encompasses approximately 1.4 million acres and is located in north central Washington state. The Caldwell Tribe has nearly 9,500 enrolled members, making it one of the largest Indian tribes in the Pacific Northwest. About half of our tribal members live on or near the Caldwell Reservation. 1, provide a $10 million increase to the BIA forestry account for reforestation and additional foresters. The Caldwell Tribe joins the Intertribal Timber Council and requests that the subcommittee increase the BIA forestry project's forest development line item by $5 million for replanting and thinning, and 2, increase BIA forestry TPA line item by $5 million to better enable Indian tribes and tribal organizations to hire additional foresters. In 2015, the Caldwell Tribes endured the most destructive fires on an Indian reservation in recorded history. The North Star and Okanagan complex fires collectively burned more than 255,000 acres on the Caldwell Reservation, nearly 20% of the reservation's total land base. Approximately 1/4 of the commercial timber land on the reservation was burned or severely affected, totaling 788 million board feet of timber. And then I added this as well. In August of 2019, the Caldwell Tribe experienced the largest wildland fire in the United States during its time. The Williams Flats Fire burned over 45,000 acres in a designated game reserve on the Caldwell Reservation. This wildland fire was unusual because the Northwest Interagency Incident Management Team reported that a flash flood occurred during the fire with large amounts of rain and flooding occurred, creating hazardous conditions and washed out many roads in the area, leaving them impassable. This posed a new challenge for firefighters and those working to move heavy equipment out of the area. 64 firefighters were caught behind the flash flood. Funding of the Forest Projects Development line item funds the necessary replanting and reforestation activities that will continue to take place on the Caldwell Reservation for years in response to both fires. The BIA has a statutory obligation under the National Indian Forest Resources Management Act to replant Indian forest land. Currently, the BIA's average annual burned area rehabilitation budget, however, is approximately $3.2 million for tribes nationwide. The BIA's entire $3.2 million budget for fire rehabilitation would cover planting and restoration of less than 11,000 acres nationwide. At current funding levels, this would mean that hundreds of thousands of acres of forest that was burned on the Caldwell Reservation in 2015 and 2019 may not be replanted for decades, if ever. Acres that were not replanted or where failures occurred from record-setting lack of summer precipitation will be added to the already existing backlog of forest development activities. Unplanted acres diminish the tribe's ability to sustainably manage forest resources for both economic and ecosystem benefits. Equally important is additional BIA funding for foresters, which are essential personnel to increasing the tribal timber harvests. The BIA remains responsible for a wide range of critical forestry functions in its capacity as trustee. These functions include environmental clearances and approval and oversight for timber and salvage log sales. Without additional funding, the lack of forestry staff to perform these and other important trust functions will continue to directly constrain tribal timber harvest levels. 2, include report language directing the Secretary to prioritize tribal requests for fire preparedness funding. The Caldwell Tribe suggests that the subcommittee include language in its fiscal year 2021 spending bill that directs the Secretary of the Interior to prioritize tribal requests for wildlife preparedness funding. In early August of 2017, the Caldwell Tribes requested $16,250 in severity funding to prepare for what weather reports predicted was going to be a severe lightning storm on the Caldwell Reservation. These funds were requested from the BIA's Northwest Regional Office in Portland, Oregon. The tribe's timely request would have covered use of additional bulldozers, personnel, and equipment to prepare areas of high risk of fires from lightning ignition. The BIA unfortunately denied the tribe's request. The lightning storm arrived as forecasted, and on August 7, 2017, a lightning strike ignited the Bridge Creek fire near the town of Keller on the Caldwell Reservation. The Bridge Creek fire ultimately burned 4,500 acres and was not fully contained until the following month. Suppression costs for the Bridge Creek fire exceeded $16 million, the bulk of which was drawn from the Department of the Interior. Wildland Fire Management Account had the Caldwell Tribe's initial $16,250 request been approved by the BIA, the Bridge Creek fire would have been contained much sooner and at a significant cost savings to taxpayers. Tribal forest managers are in the best position to assess danger and risk to on-reservation tribal forests. Tribes rely on their forest resources for many uses and purposes, including cultural uses and economic development. Tribes, therefore, have a motivation to protect their forest resources from wildfires in ways that other federal land managers do not. For these reasons, a committee should direct the BIA and the DOI generally to honor tribal preparedness requests to the maximum extent possible. 3, provide a $50 million increase to the BIA forestry account to award grants to tribes in the Northwest region to develop forest health strategic plans. The Caldwell Confederated Tribes has a forest health crisis. We are seeing large catastrophic fires, more diseased, insect-infected, and dying forests, which threaten our communities and fill our summer skies with smoke. The Caldwell Tribes request that the subcommittee increase the BIA Forestry Project's forest development line item by $50 million to award grants to tribes in the Northwest region to develop forest health strategic plans. The grant program allocated by the legislature would be to implement projects that seek to restore forest health, protect watersheds, promote the long-term storage of carbon in forest trees and soils, and minimize the loss of forest carbon from large, intense wildfires. Project activities may include forest fields reduction, prescribed fire, pest management, reforestation, biomass utilization, and I thank you for allowing me to testify.
And we've got the report language directing the Secretary to consult with stakeholders and report to the committee the potential benefits of using very large air tankers in fire suppression. So I know you wanted to get that into. Ms. Pingree.
Well, thank you all very much for your testimony, really very helpful, and helpful that you had so many details. And thank you for the last testimony. I think that's such a striking example about 16,000 invested might have saved $16 million. And so I hope that's an area where we can be more supportive. And certainly it raises a lot of concerns if there's not sufficient money to reforest lands where we've had forest fires. Not only is it a loss to income to you, but certainly on the last panel talking about climate change, we need to keep those forested lands. And I share your concern certainly about the salmon. I represent Maine, so I'm the opposite side, but we've been very concerned about our native fisheries. And Mr. Kilmer's been a huge proponent of the Puget Sound program, and I know the president eliminated it in this budget we just received, but I feel this committee will be very strong in a bipartisan way of keeping it there. The only question I had around that, and I really appreciated you talking about the importance of salmon fisheries, is the declining population just because of all the reasons we're all experiencing, or are there other people accessing the same fisheries?
So I think that it's everybody's experiencing the change.
Right.
It's not just tribal fishery. It's not commercial fishery. It's not just sports fishery. 2 years ago was the first time the sports fishermen and the commercial fishermen came to the tribes and said, let's work together, and the state of Washington, to do this. And so you're seeing it. You're seeing the concern. I always tell people, I don't want to be that generation that goes to a museum to see a salmon. You know, I am a fisherman. And I don't want that to happen for the future generations and for the kids. You know, I think we need more funding committed to the Puget Sound cleanup. And of course, climate change is a big issue,
right,
especially in the Nisqually. In 2015, we had temperatures get up to almost 70 degrees in the Nisqually. It's unheard of because it comes straight from Mount Rainier. It's glacier water. Yeah. So that should never happen. But change is, everybody wants to do what they can to protect our salmon.
Yeah, and that's an important point. I mean, that we have severe ocean warming in the state of Maine, and salmon are a cold water species. It's very hard to keep them there, and those are bigger problems than just what you guys can handle. And of course, Ambassador Dana, thank you so much. It's a real privilege to work with you and the other tribes in Maine, and I appreciated you attempting to describe. We would have to have like about 5 hearings in a row for people to understand the complexity of the Settlement Act, but it was helpful to hear a couple of specific things like self-determination contracts and the tribal courts, just in terms of ways when we can be helpful in such a massive issue. And I'm just so happy to hear that the tribal courts continue to be beneficial. So I hope we can enhance the funding there, so this very complex problem we can help out. So I'm using up my time, but thank you all very much. Thank you for your testimony. It's really beneficial to have you all here.
Mr. Joyce.
Thank you, Madam Chair. Thank you all for being here, and truly appreciate your testimony because it's what we need so we can make intelligent decisions going forward. I've had the opportunity to visit some spots. I'm continuing to go around and try to visit as many I can so I can see firsthand some issues that you've been discussing, but thank you for being here today.
You're always welcome to come to the Nisqually.
Let me know when those 8 days are.
I wanted to go back. You mentioned about the teachers' salaries, and one of the challenges that we've been having in Indian country is getting professional staff, workforce, training, scholarships for youth to go on and get their training and return back home. But wages become it's something everybody cares about. So beyond almost the $10,000 discrepancy in wages, are you also having struggles, if you can comment on housing for teachers when you do have them available to you? I mean, sometimes it's a whole package where there's a problem. Is your problem just salaries, or do you have other problems in recruiting and retaining teachers?
Thank you for the question, Betty. Basically, housing for teachers is not an issue because the housing problem we have is for tribal membership. We do have agreements and MOUs with the local university and Idaho universities for reduced tuition to help to alleviate some of this, but it's just started, so we do have a few students returning home to work at the schools, but the wages are just not competitive enough. And so our school system fails on the reservation because of the wage. So if there was a better wage in our school, our local school there, high school, actually it's a senior high school, and we just can't compete with the other schools.
No, I used to teach high school myself. I saw the salary and went, oh, it's kind of tough. One other thing, so you mentioned the Superfund cleanup. Is there anything else? I mean, you have quite a few different sites. In your testimony, you have the Mission Flats, and then you also have the Gray Mine Superfund site. So those are two different Superfunds, if I read this right.
That is correct. The gay mine is was mined on the reservation. That's the 7,000 acres I told you about. And then the Mashad Creek Flats is adjacent to the reservation, right next to the Portneuf River and the city of Pocatello. So those are our concerns that they're contaminating the area within our permanent homelands, and we take that as a serious matter that we're going to be there forever, and the city could up and move whenever they want if that's what they choose to. Can I make a comment on the fish?
Yeah.
So you talked about the fish. So in central Idaho, those fish there that you're talking about, they have to make it all the way up 700 miles upstream. And when you talk about warm water conditions, that's even worse further up you go. And we have to rely on some of them fish for our subsistence fishing. Last year, we were only able to fish 3 salmon per tributary. That's a major reduction in what our harvest limits were. And this year, we're looking at the same. And we do have a fisheries, and we try to manage fish. We have a fisheries department, and we've been buying properties to help us to enhance the fish, but for them to travel that far, their health and their condition is not the best, but that's what we get. We get what we get. And since time immemorial also, those fish used to be plentiful up there just as they were anywhere else. Now they're a mere drop in a bucket compared to what it used to be. So I'd just like to let you know that those fish have to travel almost 900 miles to get to their spawning grounds. And yet we can't just go out there and slaughter them before they spawn either. So we have to have good fishing practices. And I also am a fisherman, and my technique is not the same as the gentleman here, but we all have and share in common those basic subsistence needs. Thank you.
Thank you. Ms. Dana, I wanted to ask you about, because we talked about fish, and I want to also talk to you about the health of the four-legged population you mentioned, especially moose, chronic wasting disease. We had a hearing on that. That's something that we're dealing with. Could you maybe talk about climate change and how your moose population's holding up? We're very concerned about ours in Wisconsin and Minnesota, and I know our Canadian First Nations are concerned about this issue as well.
Yeah, for sure. I mean, climate change, I think for all of us, it should be #1 priority probably. And I think for Indigenous nations, it's woven into everything we do, every part of our lifestyle. So with our moose population, we've definitely seen an impact from climate change. You know, we have the ticks that are just devastating moose up in Maine. I know that we've had some restrictions on our hunting. Some areas are bulls only. We can't hunt cows anymore. So we're definitely seeing, I talked about the game wardens being important, getting adequate coverage on these lands, making sure we're harvesting in the right way, making sure others aren't hunting on our lands because that population is so delicate. So yeah, I think you'd be hard-pressed to find an Indigenous person that wasn't completely consumed with worrying about Mother Earth and climate change. So thank you for the question.
Can I add one thing, Madam Chair?
You certainly can.
I wasn't able to attend the chronic wasting hearing, but I know that the scientists in the state of Maine are watching very closely. We haven't been as impacted, and certainly the ticks have had a huge problem. So we kind of see it around the corner. And the other thing I was thinking about when you were asking about the impact on the forest, I know I've talked to several of the basket makers in Maine about the decline of the ash. So ash has been such a critical species, not only for baskets, but for a whole variety of things. And the ash borer has been moving north, and I know people sort of see that as, almost gone already. But, we still have ash trees, but they can kind of see the end of it, and that will certainly have a huge impact.
Yeah, the temperature swings and kind of unpredictability, it affects the sweetgrass, the birch bark, the ash for sure. So it's definitely having a big impact on a lot of things.
I was just at an exhibit in the Minnesota History Center, and it's on the first indigenous in the Minnesota area. And one of the contemporary modern Native American artists had made what the shape of a coffin woven out of ash, and it was the way of that artist kind of describing the death of the ash and what it could mean to the culture and just so many things. And it was really moving to see it, because I walked up to it and I said, at first that looks like a coffin. Who do a coffin in ash? And then I just kind of stepped back from it, and it was so very powerful. Then as you walked around the rest of the exhibit, kind of setting the scene on it. Mr. Frank, thank you so much for your testimony, and I know someone's looking down with a big smile on their face. And one of the first times I served on this committee was hearing your predecessor speak, so thank you for doing that. And I'm all about, I actually know, and probably Shelley does too, about getting the scooper tankers and that going. We have to take a really serious look, especially along the northern border, because so many of our states and the Canadian provinces, we have memorandums of understanding to help each other out. But with the intensity and the frequency of these fires, if we don't really look at the big picture for what our fire response is, we might find that we have huge holes in it that we're not even aware of. So thank you for bringing that to our attention, and I think we need to talk to the states, talk to our Canadian counterparts, including First Nations, to make sure we've really got it covered. I'm concerned we possibly don't have it covered with how long and how severe these fires are burning. And you have one in California, and pretty soon, or another part of the United States, and all the resources are gone. Anything you want to add before we close?
Can I add a comment about fish?
Oh, sure.
Talking about
We love fish here. We love to
I
eat
could
them
talk
too.
to you about wildlife, big game. We have a large reservation. We have a lot of issues with that. But, on the Caldwell Reservation, you talk about fish die-offs in 2015 because of warming temperatures in the Columbia River. 250,000 sockeye died in the river.
Wow.
We also have two dams that were constructed on our reservation, the Grand Coulee Dam and the Chief Joseph Dam, which are blockages to Chinook salmon going up into the upper waters of the Columbia and into Canada. And, we with Chauvin and other tribes there's a 14-tribe coalition that have been working to restore salmon back above the Columbia, or to the upper Columbia. And, that blocks thousands of miles of habitat. And, there are many issues of, endangered and threatened species of salmon impacting orca, as Willie has, talked about this morning. But one of the best ways to increase the abundance of Chinook, because Chinook is the primary diet of orcas, is to allow for fish passage above those two dams. We've been meeting through the Columbia River System Operations Environmental Impact Statement process. They've told us they are not going to include reintroduction into the EIS or the preferred alternative. And also we've been working with the Columbia River Treaty negotiation, which they've also said and informed us recently they are not going to include reintroduction in the treaty language. There was a large coalition of tribes and other stakeholders who put together the Northwest Regional Recommendation, which includes reintroduction of salmon.
Right.
So I just wanted to let you know that is something that we've been working very tirelessly.
Well, thank you. Thank you for your testimony. We had a fabulous morning hearing from people, lots of questions to ask the bureaus when they're in front of us, lots of ideas on funding. Mr. Joyce and I just need a bigger allocation. We could certainly put it to good use. So with that, this hearing that we're having will stand in recess until 1 o'clock.